Eastern. Welcome to the Northeast, or the region formerly known as Northeast. I don't know what we're calling ourselves anymore after this week. But again, welcome. We are going to give it another minute or so to let folks continue filtering into the Zoom room, and then we'll get started. Thanks for your patience. And I see folks are already filling the chat with dad jokes, so thank you for all of that. And we'll hope to entertain you for the next minute or so. Good afternoon, everyone. I'm going to give it one more minute just to let the participants, the number of people joining, slow down. But in the 1 minute I'm going to give you, please feel free to check out the dad jokes that are currently circulating through the chat right now. All right, good afternoon. Let's get this party started. Welcome to the Northeast Breakout session on day 2 of the FDA Retail Food Protection Seminar. We are so happy to have all of you here, and I really mean that with all the technical difficulties. I'm so happy we're all here, and I think we have a really great session planned for you this afternoon. My name is Valerie Potopsing. I'm a retail food specialist with the United States Food and Drug Administration's Office of State Cooperative Programs. I am based out of New York and currently work with the states of New Hampshire and New Jersey. You'll be able to hear from my colleagues, and all of the specialists will be speaking a little later on during this session. Just to give you an idea of the format today, we are going to be going through 3 different presentations. After the first 2 presentations, we will have a 10-minute bio break. So you will have time to get out, walk around, stretch your legs, grab another cup of coffee or your beverage of choice, and then we'll continue on through the session. You right now, please keep in mind that the chat is open. So if you have any questions for any of our speakers, please feel free to go ahead and put them in the Zoom chat. There's also the Pathable chat. We prefer, if you could, please put all of your questions for the speakers in the Zoom chat, just because it's a little bit easier for everyone and the speakers can actually see the questions as they come up. You know, I think we're all just so happy to be here virtually. I can't wait for us to be together in the same room. I think all of us are kind of needing that and wanting that. But, you know, I will tell you the one thing that I love about Zoom meetings and virtual conferences is it's established a new way of a new wardrobe category. I call it business comfort. You have formal, you have business casual, and you have business comfort. You have maybe a blouse or a shirt and a jacket and your pajama pants. So I will miss that part when we do go out to see all of each other in person. But we are happy to have you here, and we do hope to see you all in person very, very soon. So without further delay, let's go ahead and get started. Oh, the other thing about our format, we normally always had started out with welcoming remarks or opening remarks from Liz O'Malley. I see Liz is giving her secrets away. what we're going to do today is we're going to switch up the format to combat that pesky little thing called Zoom fatigue. We're going to start right out with some panel discussions. Then we'll have three speakers actually, presenting on norovirus outbreaks. And then we'll have a USDA FSIS update. Then we'll have a recognition of program standards accomplishments delivered by the retail food specialist. And then Liz will be closing us out during this session this afternoon. So please stick with us and enjoy the rest of the afternoon. I will also be your moderator. So by the end of the day, you will probably be sick of my voice. I am too, don't worry. And if you have any questions, again, please feel free to reach out and use that Zoom chat. And we do have tech support on the line if you encounter any problems throughout any of our presentations. So without further ado, let me go ahead and share my screen and kick us off. Hold on. Sorry about that. Already running into my first technical issue. Let me see what's happening here. All right, that should have done it. Can someone just confirm for me that you can see my presentation?
We can.
Thanks. Perfect. Thank you so much. And thanks, Steve, for that. We're still going to have tech issues in person, but the solution for tech issues in person is that you just hand someone another cup of coffee or a cookie. Here, no one's really helping me out with coffee or a cookie. So that's where we're at. All right, so our first session is a panel discussion entitled, Let's Talk About Pets. As we all know, pets are a really important part of our lives, and we've increasingly seen them joining folks as they dine at local restaurants. We have 4 panelists from state and local health departments in Massachusetts, New Hampshire, New York, and Vermont that'll be sharing how they've addressed pets in outdoor dining areas and in retail establishments. I want to start by welcoming and introducing our panelists for today's discussion. Heidi P. Kukulka is the manager of Nashua Environmental Health Department, one of 15 self-inspecting communities in New Hampshire. Heidi has served the city of Nashua for 27 years in varying roles within the department. Jessica Egan has been a research scientist in the food protection section of the New York State Department of Health since 2007. Jessica began her career with New York State DOH after completing her Master of Public Health in Epidemiology and has worked in both food and waterborne outbreak investigations and food safety regulation. Andy Chevrafils, is a public health inspection manager at the Vermont Department of Health. Over the past 15 years, his work with the Environmental Health Division has allowed him to hold several positions involving lead and asbestos abatement regulation, recreational water monitoring, emergency preparedness, and food lodging regulation. Andy currently manages a team of 11 public health inspectors that are responsible for the inspection of retail and manufactured food facilities, as well as lodging establishments and children's camps. And finally, last but not least, David Greenbaum is the health agent for the City of Salem, Massachusetts Board of Health. He has over 20 years of experience in public health, over 15 of which have been in Salem. In his role as health agent, he manages the daily operation of the department, supervising staff of 12 employees. David has extensive experience conducting food inspections and conducting food-related investigations. So as we kick off the panel, please remember, if you have questions for the panelists, go ahead and put them in the Zoom chat, and we will get to them as time allows at the end of the session. So for the panelists, let's go ahead and get started with our first question. Could you briefly describe the rules, regulations, and/or ordinances that you have related to pets in dining areas, and maybe provide a little bit of background about your respective agencies? And if we could go ahead and start with Heidi, that would be great.
Good afternoon, everyone. Can you hear me okay?
We can.
Excellent, thank you. We are a small department, Nashua, New Hampshire. We have 6 people full-time on staff, 3 of whom are environmental health specialists who conduct inspections full-time. And we have approximately 530 license holders right now. And a little surprised that people did a lot of swapping out of facilities during COVID, but the number really hasn't gone down considerably. Let's see. As far as what we adopt New Hampshire's HEP 2300. Those are the state of New Hampshire rules. And they currently adopt the 2017 food code. And this year, Senate Bill 17 was passed into law, allowing dogs in outdoor dining. And that had been introduced a few years back. And this year it was successful, but prior to that, state law did not allow animals in outdoor dining. And let's see, during that time, we had put together a variance process so that we could allow it. And we worked with our partners throughout the city and throughout the state to try and figure out what was the best method to do it. And we were very gratified to see that our variance process was, and it wasn't that it was our variance process, but those aspects were put into the law. And that's about it for me.
Great. Thanks so much, Heidi. And David, could we go with you?
Good afternoon, everyone. So as Valerie said, I'm the health agent for the city of Salem here in Massachusetts. You know, for the size of the city, I have a relatively large department of 12 that includes 4 staff who are grant-funded regional staff. We enforce the FDA 2013 food code here in Massachusetts at this point. And 105 CMR 590 is our food code through the Commonwealth of Massachusetts. We previously did not allow pets on outdoor patios. About 10 years ago, we had some inquiries and some pushback from restaurants who would really liked the idea of it. So my predecessor wrote a variance to the food code, both here in Massachusetts and the 2013 food code. So we currently allow, you know, dogs on patios. They have to meet certain criteria, no food prep or no alcohol preparation, things like that. They have to be under control. They have to have a plan for how they're going to clean up any accidents the pets may have. So that's where Salem stands at this point with pets on outdoor patios.
Thank you, David. Jessica, could we go with you?
Hi, everyone. So in New York State, we're a rather large state. We have about 100,000 food service establishments statewide. We have about 600 full-time inspectors. We're a home rule state, which means that our local health departments have jurisdiction over their own county. Usually it's at the county level. New York City obviously is at the city level, but generally our local health departments do their own inspections, permitting, complaint investigations. We call it our doggy dining legislation, went into effect in 2015, and that allows for companion dogs at the outdoor seating areas of food service establishments, but it doesn't require it. So it just gives food service operators the option of allowing companion dogs in the outdoor dining areas, completely separate from service animals. Service animals are still allowed everywhere, but that's sort of similar to what David just mentioned. We have certain rules that the food service operators have to comply with in order to allow doggy dining. So, you know, they have to post a sign saying that they allow dogs. They have to keep the area completely separate from food preparation, and sort of have plans in place for dealing with accidents and separate disposable bowls for dogs who might be fed while they're on site. But that's been in effect since 2015 and seems to be going pretty well.
Great. Thank you, Jessica. And Andy.
Yeah, good afternoon. Andy Sheverfields with the Vermont Department of Health. We're a pretty small program. The Vermont Department of Health has the entire regulatory authority for retail food service in Vermont. We have a great team of 11 inspectors and 15 total staff in our program. We do have a couple open positions. Gonna put a little plug. We have like one more day left on an open position. So if you want to apply real fast, we'd love it. We have a fairly an older rule based on the 2001 food code that's kind of has some Vermont tweaks to it. But moving forward, we do hope to kind of take some of the lessons learned from other jurisdictions and states that have updated their rules, and looking for an updated food code potentially to allow some outdoor dining. But currently, only service animals will be allowed in dining areas at food service establishments in Vermont.
Great, thanks for that, Andy. So our next question for the panelists, and David, you already started touching upon this in your introduction. Have you had any pushback from industry and or consumers related to pets at retail establishments, whether it be at dining areas, supermarkets, anything like that? And David, if you could start us off to kind of talk a little bit about that pushback you referenced, that'd be great.
Sure. So as I mentioned, initially our restaurant owners were really in favor of this, and I think they still are. We haven't received any pushback from customers. I think they love it. I think people like to bring their dogs everywhere. I'm a dog owner. I don't bring my dog everywhere, but we don't have a lot of pushback. We here in Salem, I recently have received one complaint from somebody, who has concerns about this particular place mixing drinks out on a patio where dogs are. So we're currently working through that. But other than that, we have had no real pushback other than restaurants really advocating to allow this to take place.
Great, thanks for that, David. Jessica, Andy, Heidi.
It's been really popular in New York State overall. We had a lot of industry asking for it before our legislation went into place. A lot of restaurants were really interested in being able to allow dogs in the outdoor dining areas. So it's really been a positive addition for us.
Great.
Yeah, I know we've had some prospective operators looking to set up like outdoor dog friendly bars, and none of them have really come to fruition, but we are aware of several establishments in the state that kind of advertise as being pet friendly, and there's really nothing formally to allow that. We try to it's hard to we want to prioritize our inspection and our inspectors' times, and really focus on some of the risk factors associated with foodborne illness. So we usually have conversations with establishments during routine inspections if there's any complaints about dogs in those outdoor areas.
I would just add that we still do not allow pets in grocery stores just walking around other than service animals. And it's become a cultural norm here that dogs are in grocery carts, in stores, and accompanying people. And I don't know what the driver is necessarily. I know that when we started having more breweries come into the area, that kind of embraced that whole culture of we have to do everything with our dogs. And I do have a dog, but he's a meathead and I would not take him out anywhere. But it's become really hard for industry to follow the rules. And I think that they get really confused about ADA regulations as well.
Great, thanks for that, Heidi. And we'll come back to the ADA regulations in a little bit as well as part of our discussion today. And Andy, you had brought up, how you really want your inspectors to really be focusing on those foodborne illness risk factors. And that's kind of a good segue into our next question for all of you. Have you had any foodborne illness outbreaks or consumer complaints linked to pets in dining areas? And I will start. If you want to unmute yourself and go ahead, Andy.
Oh, okay. Yeah, thanks.
Yeah,
I'm not aware of any historical outbreaks related in Vermont related to pets in dining areas. Like Heidi said, I think a lot of our complaints now are related to grocery stores and people bringing their pets. I mean, I see it when I go out, you know, in the carriage or the kid holding the little toy, whatever. I have a little small dog too, so I can make fun of them. But we do, you know, we do receive complaints, even it's like the owner of the restaurant has a cat or dog. They may like live above an apartment. We see this a lot in some of the small town general stores where the owners are occupying the same building as the deli or the food service establishment that they operate. So we're responding to those type of complaints. You know, once or twice a month, we might see that or less. But a lot of most of our pet related complaints are related to shoppers bringing in their dogs, typically into a grocery store that has a food service establishment as part of that.
Thanks, Andy. And I'll open it up to the other panelists, Jessica, David, Heidi.
Hey, it's David. We have not, that I'm aware of, had any outbreaks linked to pets and patios. Periodically, we do get some complaints from consumers, like I mentioned, the complaint that we're dealing with now. But for the most part, it's been pretty seamless.
Yeah, and I would echo that. In New York, we've not heard of any illnesses that have been linked back to dogs, companion dogs at restaurants. Most of the complaints that we hear about, again, because we're a home rule state, our local health departments are sort of the front line for receiving complaints. But when we've asked them about complaints that they've received related to dogs at food service establishments, they've all been, you know, with that beyond the scope of our doggy dining legislation. So the complaints don't tend to be about companion dogs in the outdoor dining areas. It tends to be dogs inside either the food prep area or the indoor dining area, and not just limited to dogs. We hear about goats at bars and all sorts of things. So I would say for the operators that are adhering to the rules of our doggy dining legislation, we've not had any complaints.
And I'll add that I am not familiar with any specific outbreaks associated with dogs in outdoor dining or any pets in outdoor dining. And we do respond to complaints. We still get complaints. Then the most recent one was at a brewery where the dog was actually behind the bar. Actually, there were a couple of dogs behind the bar, and they have an outdoor area. So it was definitely inside. The other thing, though, in another part of the state, I know that there was a dog fight outside of some outdoor dining, and a child was bitten. So we're mindful of that as well.
Thanks for that, Heidi. Has anyone else received other complaints related to dog bites or animal bites in their jurisdictions? And if so, how have you handled them?
And not that I'm aware of.
Okay.
Yeah, same here. I'm not familiar with any complaints about bites in our jurisdiction in Vermont.
We did have one complaint that we were notified of about a bite, but when our local health department investigated, they found that the operator was complying with all the rules of the outdoor dining legislation. So I don't think it had anything to do specifically with that.
Great, thanks, Jessica. All right, so let's move on to our next question for our panelists. And I do have a little bit of a lag. There we go. Have you encountered pets at retail that are not cats or dogs? And Jessica, I know you just mentioned the example of goats. Are there any other animals or pets, snakes, birds, things you've seen, things you've heard of? And then additionally, what about businesses that their sole purpose is to definitely include pets, such as I see cat cafes pop up everywhere. Are you seeing those things, and how are you handling them? And are you aware of any major issues related to their operations? And if we can go ahead and start with Jessica, that'd be great.
Sure. So I'm not aware of any other animals other than the goat example, but we do have quite a few cat cafes in New York State. And the way we have handled those is sort of to look at the food prep area, the food service establishment, as separate from the area where the cats are being housed. So as long as there's that clear distinction, you know, people go in, they order their coffee or their food, and that's all prepared and served in a separate area, then it's sort of looked at as a separate entity where people can then take their coffee into this separate room to spend time with the cats. And that's sort of a model we would apply if people wanted to do that with other animals as well.
Great, thanks, Jessica. The other panelists, David, Heidi. Heidi, I see you're unmuted.
Hi. Let's see. So years ago, I think that there was a ginormous snake in outdoor dining that somebody had wrapped across their shoulders. And the most memorable thing, though, is there used to be a gentleman who frequented the bars downtown with a bunny on a leash. So yeah, people just do strange things from time to time. And I think that we've had a cat cafe proposed, but it hasn't come to fruition. And I think that the owners are also trying to open one in another part of the state. But what Jessica explained is how we were looking at it specifically was that food service one side, mingle with cats on another.
Thanks, Heidi.
Yeah, we have one cat cafe that in Vermont, and it's operated just as Jessica has described, where there's two separate entrances. One, you walk into a vestibule. To the right, you can go into the cat adoption area, and to the left is the cafe. And you can order food and take it to go, and take it into the cat cafe if that's what you want to do. But there's no direct entrance to the cat cafe from the cat adoption area. We have received some complaints and kind of talked with the operator about making sure that they're kind of operating within what their agreement is. And so far, I feel like it's worked out fairly well.
Yeah, and for those of you who are familiar with Salem, almost anything can happen here. So I'm surprised we haven't seen other animals other than dogs rather. But I haven't seen anything exotic that I've seen in my time here. We did recently have somebody approach us about a cat cafe, and we would address it the same way as the other panelists have discussed.
Thank you for that, David. So the next question is actually a hot topic in the chat right now, ADA regulations, and how do we navigate that? So how have your departments helped to clarify the ADA regulations for service animals versus these policies that you have in place to allow patrons to bring their pets into a dining area or an outdoor dining area for that matter? So if someone could speak on that, and I see folks have put the link to ADA resources that are in the chat, so that's a great resource that's available, and people are sharing the different types of pets that they've found at retail. So it's really kind of neat to see what you all are seeing in the field as well. But for our panelists, could you kind of talk a little bit about how you've addressed ADA regulations versus your policy with pets?
So I guess from my perspective, I agree with some of the comments in the chat that ADA can be very frustrating to enforce. As somebody I think in the chat mentioned, we asked two questions. One, is it a service animal? And if so, what is the service it's trained to do? And if they can answer those questions appropriately, then we kind of let them maintain that pet inside the establishment. It's more frustrating, I think, for business owners. They really don't know how to handle it, and they don't want the confrontation, especially in this day and age, where people have short fuses, or they just don't want the confrontation. So it's very, very difficult to deal with from my perspective anyway. And I'd be interested to hear what the other panelists have. But it's not easy. So we advise our businesses to, that those are the questions they can ask. And if they feel that the answers are sufficient, then they should continue to allow that pet into their establishment. Otherwise we try to limit them to the outdoor dining areas. We try to make sure that they're not going inside unless they are an approved service animal. But again, it's very difficult.
Yeah, I know industry really struggles with enforcing, interpreting the ADA. We kind of routinely remind establishments of the ADA fact sheets and guidance documents. Even with that, though, every couple months there seems to be something that comes out in the news where there was a disagreement between a customer and an operator about what is allowed. And there was one within the last couple months at a restaurant in Burlington that the individual that did have a service animal, and it was a legit service animal. They had it for a specific reason. It was trained, it was well behaved, and they wanted to eat inside, and the operator just would not allow it and was firm. And the individual with the service animal recorded that whole interaction and put it on TikTok, and got millions of views. And it ended up that the restaurant got a lot of fake negative reviews for the restaurant, and the individual got a lot of online harassment. So she had to take the video down. The restaurant apologized. It was really not. It was an unfortunate situation. So what did end up happening, though, is the restaurant, really took that as an educational opportunity, apologized. And, it was in the news quite a bit up here. And so it did help inform other establishments and the public about how to appropriately interpret and enforce the ADA. So in an unfortunate situation, but hopefully there was some lessons learned.
Thanks for that, Andy. We did have a question in the chat specifically for Jessica about just kind of looking at what David shared about what Massachusetts does and how they handle the questions that they can ask related to ADA service dogs. They wanted to know, in New York State, are those questions still the same, or is there anything else that New York State allows you to ask or does not allow you to ask, although the ADA is federal regulation?
Yeah, so because the ADA regulations are at the federal level, they apply in New York State as well. So generally what we do is we try not to interpret ADA regulations too much. We usually will just refer people to the ADA website. We did, though, at our level, work in language to our legislation that specifically says that service dogs, service animals are that our legislation is not applicable to those. They're considered a separate group. And one component of our legislation is that food service operators who want to allow companion dogs have to post a sign. So we, telling everybody that they are allowing companion dogs. So we created a sign for them to use. They can certainly use their own if they want, but we created a sign template, and right in the sign we posted that guide, hearing, or service dogs are allowed indoor and outside, sort of to kind of make that distinction, because it really is a tricky subject. And I know a lot of the complaints we hear about are companion animals that are being called service animals when they're really not. And I think that's when a lot of industry sort of is caught between a rock and a hard place, because you can often tell that they're not service animals, but if an owner is saying that they are, and sometimes they even have collars that say service animal, because you can buy those right on Amazon, it gets really, really tricky. So yes, ADA regulations apply in New York State. The same two questions are what sort of limits are operators, but we do try to work that in as best we can. The other thing that I think is important to tell industry is that even ADA recognizes that some dogs are aggressive. Usually those are not the legitimate service animals, and they can restrict those types of dogs from their establishment. That's right in ADA regulation.
Thanks, Jessica. That's a really important point. Heidi, go ahead.
I don't think that I have anything novel to add. It is a challenge for business owners and for employees to enforce this. And so I've been seeing some of the comments in the chat, and So I think that what we do is we typically do a one-on-one type of try to guide people into doing the right thing, but they are terrified of being either sued or having their business destroyed on social media.
Yeah, and I think someone actually put in the chat, it's kind of like a catch-22 for business owners. You know, it's kind of polarizing in that they don't know that they want to allow it. They want to make your customer happy, but they also want to follow the regulations, and they want to make sure that whatever's happening within their establishment is not going to cause an illness or an injury. So it is a very, very slippery slope. Just to I'm seeing in the chat, there are a few questions related to this specific question. So I'll bring them up now. Do food service establishments like the cat cafes, do you allow pet food to be stored with human food? For those of you that have cat cafes.
I mean, the agreement is that the operations are separate, so the cat food should be stored separately in the cat portion of their building.
Yeah, I would agree. It's usually not an issue because they are separate, even just for convenience sake. We don't tend to see that as being a big concern. Usually that cat food is kept in that separate side of the building.
Great, thank you for that. Also in the chat, another related question to this question is, how do you deal with pet owners who may come alone to an establishment with a pet? What do they do with their pet while they order food? So I guess this is kind of, you know, if it's like you have to go inside to order your food and then bring it outside, have any of you run into that? Do you have a specific guidance or a regulation that speaks about that, how to address that?
We don't have a specific regulation that addresses it. Again, if they're going into the establishment, I would fall back to the ADA. But when they're ordering food outdoors, you know, the waiter or waitress goes out to them and deals with them at the outdoor level. They don't go into the establishment to order the food and bring it out.
And I'd add too that most food is ordered online now and delivered by DoorDash or with one of the other entities, or by phone. So we don't really see that as a huge problem that we've encountered.
Great, thank you for that. And thanks for answering the questions kind of on the fly as we go from our participants. Our next question is, have you developed any guidance documents for your staff, for industry, and or patrons or consumers about your pet policies? And if we can start with Jessica, that would be great.
Sure. So our legislation was actually written pretty well. It's pretty plain English. So what we did is we just sort of linked to that legislation directly on our public page. And then, as I mentioned, we did create a sign that operators can just print right off our website that just makes clear that they allow companion dogs and makes that distinction between companion dogs and service animals. So those are both available on our public page for printing. And we really haven't had a lot of questions beyond what we've provided. So we haven't needed to make any sort of separate guides with regard to this.
Thanks, Jessica. David?
So our variance is it's an application process, and attached to that is a list of conditions that apply to the variance. And if approved, they have to post that list of conditions. It, you know, it includes things about how they clean up after an accident, and disinfecting and sanitizing tables and chairs after a dog has been, even if they're only on the ground, which they should be. They should not be up on the table or in the chairs, but it still requires that sanitization and disinfection. And it's just a laundry list of things that they have to comply with to actually be able to maintain the variance.
Thanks, David. Heidi?
Yeah, that was when we had a variance, it was the same process. So we have that at the ready, and it's now reflected in state law. So we can kind of use those again for you know, educating industry to what they should be doing and what they must be doing.
Thank you,
Yeah, and
Heidi.
we don't have any specific documents that we've developed. We utilize some of the ADA documents that are available when that's the issue.
Thanks, Andy. All right, and the next question that we have for all of our panelists is, if you could go back and revisit your guidance documents, your current regulation, is there anything that you wish that you would have thought to include or address when you were writing or implementing your current rules, regulations, and or ordinances? If you could have anything you wanted in the world to be included in your regulation without having to lobby and get someone to sign off on it, and in a perfect situation, is there anything that you would add or address or at least think about a little bit more when you were developing your new rule or editing your current rule? And if we can start with Andy, that would be great.
Yeah, I mean, it's been a long time since our rule was revised, and I know right before the pandemic, we were in the process of drafting that, and that's kind of been the timeline for that is still on the horizon, but it's been readjusted a bit. And so I think we'll definitely look towards whatever version of the food code is available, hopefully a new one soon for that. That might have some updated recommendations for outdoor dining and pets. So I think that will be a good change, and to help kind of have a level playing field for operators that do wish to have dogs or pets in the outdoor dining areas. I do think I think as a whole there's a lot of work that we could do as regulators across the country, is to come up with good guidance and good training for industry on the ADA, because I think that's not going away. And there's always going to be some difficulties for industry to enforce that. So I think there's some work that we can all do to try to help that for the public and for industry.
Thanks, Andy. Jessica, could we go to you?
Yeah, I would agree with Andy that I think it would be nice if there was more for operators with regard to the ADA. I think it would probably have to come from them since it's their regulation, but from our end, I think we've been very fortunate. It really has been a non-issue since it passed in 2015. And so I can't think of anything right now that we would add on our end. Really, it hasn't been an issue for those operators that are doing it and doing it according to the rules.
Thanks, Jessica. David.
So I would probably take a look at our list of conditions that go to it. The place I mentioned earlier, we've received a complaint about them mixing drinks and potentially preparing food outdoors. It's a large beer garden. It has the potential to maybe set a space limit where the dogs have to be so many feet away from these areas. So that's something I would probably look at. But for the most part, I think that our variance is thorough, and I don't know that I would change very much at this point. I do agree with Andy around the ADA stuff, though. I think that would be extremely helpful.
Thank you for that, David. And Heidi.
I don't think I have anything really to add. The state law was changed this year, so the state is adjusting overall, and I think that what we had put in for the variance was pretty effective. But I think that operators and owners are going to always be challenged by ADA regulations, and so I think that we do need to remain diligent in educating them to the best of our abilities.
Great. Thank you for that, Heidi. Those are the questions that I had for you as part of the panel today. We do have some questions in the chat that I know that we didn't address yet, so I'm going to start going through those. And my colleague, Tom Nerney, who I forgot to introduce at the beginning of this, he's going to be helping out. He's monitoring the chat for me as well. So Tom, if there are any questions that I have left out, please feel free to let me know that I lost them.
Yeah, there's kind of a bunch of questions that are all tied together. Celine asked if there are health requirements for doggy patios or cat cafes, and others. And I will point out that the city of Nashua posted a link to theirs, and also the Texas law. is posted in chat as well. And Dorothy asked if Heidi wouldn't mind sharing her variance language in variance form. I don't know if you could put that on chat while the session is going on, Heidi. That would be great. And Katie was asking Heather if she could share a link to her sign as well, if that's possible. One question we had that the panelists may want to take a shot at stated, has messaging or education to the public changed to inform health risks with pets in all of these spaces, grocery, shopping, movie theaters, etc.? Any public health messaging that's been done?
So I'll just say for New York, we haven't really had to do any public health messaging specific to companion dogs at dining. You know, we do have things on our public page that will link back to CDC for, you know, pet turtles and other pets that are commonly associated with illness, but we haven't had to do any public health messaging with regard to different pathogens and dogs, companion dogs at dining.
Thanks, Jessica. Anyone else?
I think that would be the same for us here in Salem. We haven't done any additional messaging around dogs on patios. Periodically, we do get some foodborne illnesses that trace back to geckos, turtles, things like that. So we try and educate people who have those pets about the dangers of salmonella and things like that from those animals.
Thank you. Here's a specific question about requirements. Are there distance requirements for tables that allow dogs in the outdoor dining areas? I guess that would be for those of you that have a policy.
I don't think our variance calls for a distance requirements for the, you know, between tables for dogs.
Yeah, we don't have a specific distance either. Our legislation does specify that there needs to be a separate entrance to the outdoor dining area so that people don't have to bring their dogs through the indoor portion in order to get to the outdoor dining area. But we don't have anything specific to distance.
Thank you, Valerie.
Sorry.
Thanks, Heidi. That's all I had. There's one more that just appeared in chat. Is there any protection for patrons with severe allergies to animals?
So our legislation in New York doesn't have anything specific to pet allergies. You know, it seems to be that people who either don't want to eat next to a dog or who are allergic to dogs just choose not to eat at those restaurants that allow companion dogs, but we haven't had to do anything legislatively or in our regulations to address that.
And neither have we. I would imagine that most people would see the dog and ask to be seated as far away as possible or a certain distance away because of their allergy. I'm not sure. There could be some discussions about it, but we haven't had any issues with that as of yet.
Valerie, that's all the questions I noted in chat. I don't know if I missed anything, I apologize, but maybe you could retype it in chat now if you had a burning question. Other than that, Valerie, I'll turn it back to you.
Thanks so much, Tom, and thanks, Tom, for monitoring the chat for any questions. I did have a follow-up question from Celine. I just clarified, her question was, are there health requirements for doggy patios or cat cafes? And specifically, she was wondering from the panelists, do you have any requirement in your regulation for the animals to have rabies vaccinations?
The law change requires that they be current on their rabies vaccinations for New Hampshire.
Well, I think the cat cafes we've seen here in Massachusetts, it's more of an adoption facility. So I don't know if that would change the requirement for a rabies vaccination. I would probably defer to our animal control officer to see if he would require that.
Yeah, and in New York State, that's sort of similar, that we do have, for example, rabies vaccine requirements, but that is not included under our food safety regulations. That would be under our Bureau of Communicable Disease Control. They would sort of handle that end of things.
Yeah, similar in Vermont, we kind of looked at the cat adoption as a separate facility, and they were working with a local adoption agency, and would have to deal with the vaccination status for those animals on that end.
Great, thank you all for that. And I'm not seeing any new questions in chat. So if you do have another burning question, as Tom said, go ahead and get it in chat. All right, so I see a question. Are there separate areas for service animals in a facility? And I'm seeing Heidi, everyone's shaking their head no. And again, ADA, the regulations kind of supersede that. I don't want to speak for our panelists, but did someone want to come off mute and kind of address this?
No, you hit it right up,
Yeah.
right where it is.
All right, well, I am not seeing any new questions. I want to thank all of our panelists today, Jessica, David, Andy, and Heidi. Thank you so much for really sharing your approaches to regulating pets in retail establishments. And remember, if you want to connect with any of our panelists, you're able to send them a direct message through Pathable, and their contact information is also available on the bios. And I do see another last minute question, so I'll go ahead and address it just because we do have another minute or so. Private facilities, do they need to have proper signage for service versus companion pets? Does anyone address that as part of their current regulation?
Not really, again, because it's so difficult under ADA because you're limited with what you can ask. And if they can answer those questions, then, I don't think we would really try and regulate that at this point.
Yeah, same in New York. Service animals are allowed basically everywhere, so we don't have anything separate with regard to rules for them.
Great.
I have noticed in industry that's non-food related that the Home Depots and the Lowe's are struggling with that. And I'm seeing newer signs posted clarifying that pets are not supposed to be going into those stores, but that's an age-old tradition as well. And so it's going to be a huge challenge.
Thanks so much. Again, thank you to all of our panelists today, and thank you to our attendees for all of the great questions. We are going to take a break until 1:10 p.m. Eastern. So go ahead and leave their Zoom open. You don't need to log out and then log back in today. For today's session, everything is going to be held in this one Zoom invitation. So go ahead and feel free to take a break until 1:10 p.m. Eastern, and we'll get started with our presentations on norovirus outbreaks. Thank you, everyone, and thanks again to our panelists, and thanks for Tom for monitoring the chat. Hi, Matthew Payne. If you can just come off mute and put your video on, we'll just do a quick test for you.
Okay. Can you hear me okay?
I can. You're all set. Perfect. Excellent. And just so you know, everything is being recorded now. So just you want to turn your video back off and your audio back off.
Sounds good.
Thanks again, Matthew.
Thank you.
Welcome back, everyone. I have 1:10 p.m. Eastern, and so if you all know me, we're going to get started promptly because we have a really great session for you planned next. Our next session is a topic that's really near and dear to all of our hearts, especially this week, Norovirus. We're going to hear from 2 state health departments about their investigations. Please remember, if you have any questions for our speakers, please place them in the Zoom chat, and we'll get to as many questions as we can after both states have presented. So I'm going to go ahead and start pulling up the presentation since it took a little bit longer than anticipated last time. And can I get a confirmation that you can see the presentation?
Yeah, looks like I can.
Perfect. Excellent. Thank you. So our first presentation on norovirus this afternoon is from Emma Cregan and Christopher Slayton from the Rhode Island Department of Health, and it's entitled Norovirus on a Roll. Emma is a public health epidemiologist at the Rhode Island Department of Health within the Center for Acute Infectious Disease, or CAID. She currently specializes in enteric illnesses and assists with various infectious disease response for Rhode Island Department of Health. Prior to her time at CAID, she was an epidemiologist for Rhode Island's COVID-19 response. Christopher is a public health epidemiologist at the Rhode Island Department of Health. He is Rhode Island's Rapid Response Team Coordinator, and he coordinates Rhode Island's foodborne outbreak response. Emma and Chris will be walking us through their norovirus outbreak investigation related to lobster rolls. Emma and Chris, welcome, and please feel free to unmute your lines and turn on your videos and get started when you're ready.
All right, awesome. Can you see me and hear me?
We can.
Okay, perfect. All right, so hi, like Valerie said, my name is Christopher Slayton, and I'm joined today by my colleague, Emma Cregan. We're going to be presenting on a Rhode Island norovirus outbreak that happened to us last summer. And quickly, I just wanted to say thank you to Valerie and her team for inviting us out to present to you guys today. Next slide, please.
Sorry, there's a little bit of a delay. I apologize for that.
No stress.
There we go.
Oh, cool. So just a little bit about Rhode Island. We have about 1 million residents here in Rhode Island, and we are the smallest state in the union. We have a centralized health department structure with no local jurisdictions. And so this really means that Rhode Islanders' health starts and stops at the state health department. And so keeping this in mind, Rhode Island's Rapid Response Team is responsible for responding to the vast majority of our food-related emergencies. And so just to go into a little detail about our Rapid Response Team, it spans 2 departments of Rhode Island state government and our FDA district office. We have Rhode, where we have the Center for Food Protection. We're responsible for licensing, on-site investigations, food regulation, the Center for Acute Infectious Disease Epidemiology. They're really responsible for our disease surveillance, including enteric pathogens. Our state health lab, and they serve as subject matter experts in sample analysis, anything like that. Our Center for Emergency Preparedness and Response, they assist with any overflow that we might have, getting us resources and logistics. And the Center for Healthy Homes, where a toxicologist is housed, and he really serves as a subject matter expert and assists us with our outbreak investigations. And then our Center for Drinking Water Quality, and they regulate our public water supply. And then at the Rhode Island Department of Environmental Management, we have the Office of Produce Safety, and they're really responsible for our farms and agriculture, and our Office of Water Resources, who regulate our shellfish harvesting areas. And then obviously our federal partners at the district office here. Next slide, please. And so just a quick slide, just a little bit about our kind of approach to our foodborne outbreaks is we kind of use this 3-leg stool approach to outbreak investigations. Our environmental health, epi, and lab teams collaborate pretty closely to investigate foodborne outbreaks. We're really the people who are most involved in them. And so here in Rhode Island, that's the Center for Food Protection, where I'm based out of, the Center for Acute Infectious Disease, where Emma's based out of, and our state health lab. And so we do occasionally collaborate with other state partners and federal partners as necessary. Next slide, please. Awesome. So jumping into the outbreak investigation. So this, like I mentioned, this outbreak was identified through our illness complaint system early in the summer of 2021. I got a complaint stating that 8 people became ill after attending a wedding here in Rhode Island. During the initial few interviews, it's pretty easy for me to tell that this group had a lot of exposures together. And it's going to be very hard to tell any of them apart as far as trying to figure out what could have made them sick, right? And so they basically all had diarrhea, vomiting with Noro-like symptom duration. And so that was kind of everything I was able to gain from that party, right? And then literally about an hour later, I received another illness complaint stating that 2 individuals had become ill after eating at restaurant A. And so this was a restaurant that party A had mentioned in their food history. So that immediately to me was a red flag. And so I was kind of focusing in on that. And it also helped that party B didn't have any other shared food exposures in their history. And so looking at the food histories from both the 2 parties at the establishment, they both reported eating lobster rolls, and party A also reported raw oysters as well. And so because it was kind of a red flag for us, we sent an outbreak investigation team to restaurant A same day, as quick as possible. Next slide, please. And so during our outbreak investigations, we kind of have checklists and some guidance for our inspectors when they go out. And so a lot of these things kind of focus in on a few things, especially in this situation where I've kind of got an inclination this might be norovirus, right? So we're looking for any ill employees. And we learned right off the bat that 5 employees had called out sick and that the restaurant received 4 reports of illness in the last week. Maybe any employees that might have been working while ill. So some of the ill food workers reported working on the days that the claims ate at the restaurant. Again, big red flags. Vomiting events. So this is kind of funny. There's a vomiting event at an adjacent sister restaurant. These 2 restaurants kind of share a walk-in and a few other facilities, and I believe they're owned by the same people, but they don't have a lot of employee crossover. And so the vomiting event was actually somebody in party A who had eaten at the suspect restaurant the day before they went to the sister restaurant and then got sick while they were at the restaurant. So kind of interesting. Hand hygiene, and in this situation, everybody was wearing gloves. They did have good glove practice, right? So that was good to see. And so we also did kind of a food flow, right, for the lobster salad. And so the lobster salad or lobster roll kind of consists of a commercially packaged lobster meat. It's pre-cooked, mayo, celery, salt and pepper. There's no cooking involved in the preparation of these rolls, and the ingredients are combined cold, and the lobster salad is added to a bun with mixed greens. And so we were able to identify a food worker that prepared the lobster salad prior to being served to the guests. And so with all these ill employees and ill food workers, ill people and ill food workers, the Center for Acute Infectious Disease had their nurses follow up with the ill food workers, and we had other staff follow up with the ill patrons. Next slide, please. And so, so what do we find at the restaurant, right? So inspectors found employees eating in the kitchen during the time of the inspection. I think it's pretty obvious that eating by employees in food preparation areas is prohibited because of the potential for hands, food, and food contact surfaces to become contaminated. Inspectors found employees drinking out of open beverage containers in the kitchen as well. Again, employees should not be drinking out of open beverage containers in order to prevent cross-contamination and hands and the container and exposed food, right? And so what we didn't see was bare hand contact, and I kind of mentioned that before. Everyone was wearing gloves throughout the entire process. So, and during the time of the inspection, the inspectors provided guidance on cleaning and hand washing to the establishment, so they could hopefully rectify some of the issues right then. And then we also kind of asked the restaurant to close voluntarily for about 3 days. So, next slide, please. Pass it over to Emma.
All right, thank you, Chris. So after reviewing all of the information we knew, our medical director recommended that all employees submit a stool specimen. And as Chris had mentioned, Restaurant A did close for a period while those stool samples were in progress. And we used our state contracted courier service to deliver and pick up stool kits from the restaurant, just able to help us speed up the process. And in the end, 42 out of 77 employees submitted a stool sample. Next slide, please. So our Rhode Island State Health Laboratories tested all the stool samples for norovirus, and they used the BioFire GI panel and also their Cepheid assay to process all these samples quickly. And we used the BioFire GI panels to test food workers who had originally reported symptoms and to detect any other pathogens involved. But one note is that that panel can't differentiate norovirus genotypes, whereas that cepheid assay can. And so in the end, a mixture of the two tests were used so that we could go through those samples as quickly as possible. So for our results, 6 samples were positive for norovirus, 2 were genotype 2, and then 4 were undifferentiated genotype. And 1 employee who tested positive for norovirus also tested positive for enteroaggregative E. coli. And to note, no ill patron submitted samples. We were able to interview many of them and get a symptom profile and food history, but many of them were no longer available to do a stool sample. So this was the information we had. Next slide, please. So our nursing team and our investigator team interviewed those 6 employees who tested positive for norovirus, and 5 reported an illness consistent with norovirus. 4 of the positive employees were cleared to work as they were symptom-free for at least 48 hours at that time of interview. And so 1 of the employees was asymptomatic but did test positive, and they were excluded for 48 hours after their test result to ensure that symptoms did not develop. And there were 2 other ill employees that did not test positive for norovirus, and they were still interviewed by our team, and they were cleared to work as they were symptom-free for at least 48 hours at time of interview. And next slide, please. Thanks. And so our interviews with ill food workers did reveal that some employees also worked at other licensed Rhode Island establishments. And so our center here notified food protection right away, and the Center for Food Protection reached out to those other establishments directly. They provided ill food worker guidance, hand washing guidance, and cleaning guidance. So excluded employees were excluded from all of their food handling roles, not just at this affected restaurant. Next slide, please. So to get into our outbreak analysis after we were able to do all of the interviews and gather data. So the outbreak case definition was an individual who experienced an onset of vomiting and/or diarrhea on relevant dates and had worked or dined at restaurant A. And there were 23 primary and secondary cases associated with this outbreak. 15 primary cases were in ill patrons. There were 7 ill food workers and 1 secondary case who was a food worker's child. And just to note a bit more, so besides Rhode Island, cases lived in 6 other states. There was a median incubation period of 30.75 hours for those we have the info available for, with a range of 18.5 hours to 41.5 hours. And then a median duration of illness of 24 hours, a range of 5.5 to 71 hours for that. Next slide, please. So just a bit more information about what we were able to find. So this shows an epidemiologic curve of primary cases and ill patrons associated with this outbreak. You can see that it's all kind of clustered around, early June, tightly clustered in a few days here. And next slide, please. And then regarding the symptom profile, so this table shows symptoms of primary cases among ill patrons associated with the outbreak. So even though we weren't able to get any stool samples from ill patrons, we were able to get their symptomology. And you can see that, it is a symptom profile consistent with norovirus. Everyone reported diarrhea that we were able to interview. And you can see some other common symptoms there included nausea, abdominal cramps, fever, and fatigue. And next slide, please. So after our staff did thorough interviews with all those ill patrons, learned about their food histories, the food vehicle was determined to be the lobster salad, and Chris had described that food flow earlier. And so 14 out of 15 ill patrons reported eating that lobster salad. And laboratory testing and food worker interviews confirmed that the employee preparing that lobster salad did test positive for norovirus. That employee was asymptomatic, but they did test positive and have that job duty. And then back to Chris.
Awesome. Thank you, Emma. So just to go over some control measures. So like we kind of mentioned, we required every employee to submit a stool sample prior to returning to work. If they didn't submit a stool sample, they had to wait 2 incubation periods before they could come back. So that was about 4 days. I believe it worked out as like the following Monday. And so we also required the facility to get a consultant to help them rectify all the issues that they were seeing. I think this went really well for them. The consultant was able to put on some trainings around hand hygiene for the employees and really do a lot of great work with them. I think part of the issue we were seeing here, though, is that the employee rotation, right? So this is during a time where we weren't really, there wasn't a ton of people in the workforce, right? So the restaurants were having a hard time finding people. So there was a lot of employee turnover at the establishment. So they're having trouble keeping things trained. So I think the consultant was really able to help them and kind of give them some materials and put on those trainings that across the summer that really, assisted them in getting these issues together. So, and then we also provided hand washing and cleaning guidance to every licensed food establishment in Rhode Island that we have an email on file for. So probably missed a few there. And then another thing I kind of wish I'd added to this slide, Emma mentioned it, but excluding ill employees from other food establishments that they work at. I think this was during a time where a lot of employees were working at multiple establishments. So making sure that we're able to catch all those people and not let them work at other establishments and kind of continue the outbreak was really big for us. So next slide, please. So, so just some strengths from our outbreak investigation. So this is one of the first times we were really using our courier service. This really allowed for us to have quick delivery and return of stool kits. We were able to open up the establishment much faster than we would have been able to without the service. So really helped us out. Rhode was really quick to interview everybody that we knew was sick or any of the employees involved with the outbreak as fast as possible. And we were able to actually get some student interns involved as well, to help them get experience and help us interview people faster. And again, I kind of mentioned this as a control measure as well, but we reached out to other establishments where ill employees work to prevent further spread. And within Rhode, we actually had really good communication. We worked really quickly to kind of end the situation, get the restaurant open quickly, and everything like that. So next slide, please. So some areas we could improve. So something we learned during the outbreak investigation is that we need to send out guidance to the restaurants to not throw away unused or untested stool kits. So we created a document that goes out with the stool kits now. So hopefully they don't throw those out because it's kind of a waste of money, or we don't get to test all the stool kits that are available. We had that issue with this establishment, and I think they threw out a few stool kits. We also learned to make sure that our lab had excess supply for large outbreaks. So this was the first time we really had required something like this, like a stool samples for all the employees at an establishment. And so we kind of were concerned if we would have enough resources to test all 77 of the stool kits if they were to come back. Luckily, we only had half of that, but if we had everything, there was a little bit of concern around that. So now we keep an excess of supplies on hand just to make sure that we have everything that we need. And since as many employees were tested as possible, our state health lab had to actually work over the weekend to finalize testing. And because of this, this allowed our restaurant to open sooner as they needed more staff cleared for opening. And this was a big money-making week for them in the area they're in. And so we were able to get them open as soon as possible. Next slide, please. So just a little bit of summary here. So like we mentioned, lobster salad was confirmed as the food vehicle for this outbreak. Norovirus is the pathogen. There were 23 primary and secondary cases. And this was Rhode's first time requiring stool samples for all employees. So this was pretty big for us. Lots of resources. It was resource intensive and it was a learning experience for all of us. We identified the contributing factor as C11, gloved hand contact by a food handler who's suspected to be infectious. So kind of like I mentioned earlier, we didn't see any bare hand contact in the establishment, but they did have some contamination issues with open beverages and eating in the kitchen, right? So definitely could have transmitted it through there. And so we actually had to go back multiple times after this outbreak for repeated violations. They didn't have a certified food safety manager when we went back the second time. Hand hygiene related issues, so different ones like no soap or paper towels at hand sinks. And their dishwasher chlorine concentration was 0 parts per million, so not a lot getting sanitized there. And they did have some repeat cold holding issues that kind of popped up every time we were there. And this is where we really hoped that the consultant was able to kind of help them out. And so this was actually not their first norovirus outbreak either. They had one, I believe, in 2018 or 2019. where they had a bartender that was ill, and they make these really elaborate drinks where they skewer a bunch of fruit on top of a bar drink, and the bartender was doing that with their bare hands. And so they were kind of transmitting norovirus that way. So this is not the first time they've had this issue. It's not the first time we've been there. So we are kind of looking at how we can prevent this in the future and at other restaurants, right? So this particular restaurant is getting more frequent inspections. And we're kind of increasing our outreach during tour seasons as well. So we're kind of sending out guidance to all the establishments and reaching out and trying to get stuff out on social media and everything like that around those times. We're really trying to make sure that facilities have a way to address diarrhea and vomiting events. So this particular facility did have a diarrhea and vomiting kit. And the manager did clean up the vomiting event that occurred in the sister restaurant. So everything kind of checked out there and went fine. But in the event that something like that happens, we want to make sure that all of our establishments have the ability to clean up those events. And like I kind of mentioned, I've kind of been, I've said this a few times, we did require them to get in a consultant. And that's one of the ways we really hoping to help them prevent this from happening again. And just like making sure we're sending out guidance to all establishments at the start of norovirus season to kind of get ahead of the curve. We did it reactive in this situation. I think we could be a little bit more proactive with that. So, all right, thank you. Next slide. And so Valerie, do we have time for questions now, or is that after?
We're actually going to wait, Chris. Thanks, Emma and Chris. Thank you so much. We do have a few questions in the chat. We're just going to hold them until after Matthew's presentation. So you can go ahead and mute your lines and turn your video off. And Matt, if you want to come on, I'll pull up your presentation as well. All right, Matt, can we just check your audio while I'm switching over presentations?
Yep. Can you hear me okay?
I can. Perfect. All right. So again, if you continue to have questions, continue to go ahead and put those in the chat box. And we are going to go on to our second presentation on norovirus, entitled, Oops, They Did It Again, 2 Norovirus Outbreaks at the Same Establishment. And this presentation is being delivered by Matthew Payne. Matthew is an epidemiologist with the Connecticut Department of Public Health's Food Protection Program. Sorry about that. Matthew has been with Connecticut's Food Protection Program for almost 3 years. And during this time, he's been involved with state efforts related to COVID-19, foodborne outbreaks, training and certifying new food inspectors, and involved with the Connecticut's Rapid Response Team. Prior to that, he's had 11 years of experience regulating food establishments and investigating foodborne illness outbreaks. He's also served on several board positions with the Connecticut Environmental Health Association. And Matthew's going to be talking about not 1, but 2 norovirus outbreaks at the same establishment, as I mentioned. And welcome, Matthew, and please feel free to take it over when you're ready.
Thank you. You can advance the slide, please. So just a explanation of how the presentation will go. Talking about the first outbreak, then the second outbreak, the links between the two, and then just a final summary. Next slide. So right after Christmas, our local health department received a complaint regarding 7 patrons that began experiencing GI symptoms after eating at the same restaurant. Additionally, we got 2 other reported similar symptoms on an independent website that many of you have probably heard of, and it'll be referenced later in the presentation. And patrons reported eating at the establishment between December 20th and December 24th. Next slide. So what you're seeing here is the frequency of the complaints that came in. So right after receiving the initial slew of complaints, we had a large uptick the following day, including media reports. So shortly after this, whether, how it got to the media, the local health department started experiencing inquiries about what was going on, and then the following day even more came in. So we received quite a lot through local. The independent website referenced on there is the yellow, and then DPH, where I work, received 2 that day as well. So to assess the extent and severity of this, DPH worked with our EPI program, created a survey to the 74 complainants had provided an email during the 28th to the 31st and sent it out to case definitions. And that included about 121 patrons that completed this. 69 of them reported illness, 26 were healthy, and 26 reported illness that didn't meet the case definition. So you can see here quite a bit of time there, and also a press release mentioned on there right after New Year's, identifying it as norovirus. Next slide. So 54 of the 69 respondents reported that they were female, and the age range was between 14 to 73 years old with a median of 44. Our incubation period was anywhere from 1 hour to 49, with the median being 32 hours. And the duration was anywhere between less than 1 day to 6.5. The average, the median there being 2 days. The symptoms primarily were nausea, diarrhea, and vomiting. 7 patients sought medical care, and 1 was hospitalized. Unfortunately, there was no deaths. Next slide. Our EPI program did a case control analysis with those survey results to find out what we could determine for food. So from that, we had patients with, we had 69 cases that were patients with 26 non-ill survey respondents that found consuming any of 6 salads that were served at the establishment had a high odds ratio with a pretty good confidence interval, as you're seeing there. And salads were eaten by 57 or 83% of our case patients, and only 12% of our non-ill respondents. No other food items at this point in time were associated with the illness statistically. And that's just important to note where we got from the survey from the ill patrons. Next slide. At the same time as this is going on, the environmental side of things is ramping up. So in Connecticut, we have the local health departments, and we also have the Connecticut Department of Public Health and our unit, Food Protection Program. So the local health department, they visited the establishment on 2 days and did food handling practice observations. And they really picked up the bulk of the work, which was the interviewing of the majority of the food workers using our standardized form. And what you'll see here is that they interviewed 53 of the 59. The other 6 can be attributed to not being able to get a hold of them, or they may not have been in that window. Employees who had just come back or from school. So it really varied there, but it was only about 6 that were missed. 10 of them reported vomiting or having diarrhea previously. That's you're seeing there 16 days out before the complaints came in, and 3 reported that they had worked while being symptomatic. At the same time, Food Protection went out and conducted a NEARS assessment, and what we found was inadequate hand washing, bare hand contact with ready-to-eat foods. And along with hand washing, there were problems with our hand sinks. So 1 was broken, 1 was clogged, 1 was inaccessible, and 1 only had hot water that was too hot for the workers to use. So looking at that alone, no surprise there that we had issues with hand washing with the facilities. They also didn't have a written policy on excluding ill food workers, which is important to note because of the fact that we had so many reporting having symptoms and working while symptomatic. Next slide. And with this investigation, we sent samples from the food workers, and also were able to get stool samples from patrons. So all in all, we had 10 patron samples and 10 worker samples that were able to be sent out for this. They went to our local health department, our local state Department of Public Health laboratory, and they were able to do norovirus testing there. And what we found were 9 out of the 10 patrons tested positive for norovirus genogroup 2, and 8 out of 10 also tested positive for that same genogroup. So that got us thinking, this is a pretty solid link here. One of the 8 workers also tested positive for another genogroup, and this person also worked while symptomatic and prepared solids a few days beforehand. Next slide. The control measures that were put in place at this point in time was the establishment voluntarily closed for 24 hours on the 27th, which when you're looking at that graph was the third bar, which was the peak of our epi curve there for the complaints that were coming in. And ill workers were excluded from the operation for 72 hours after symptom resolution. Before reopening, they had to relocate a hand sink, and the clogged one was fixed. Menus were reprinted. An ill food worker policy in writing was adopted. The entire establishment was cleaned by in-house staff, and 4 employees completed a certified food protection manager course. Next slide. So after all that, normally one would think we're okay. That we're, hopefully we're on the coming back up on that. And as you guys already know from the point of this presentation, go ahead and move on to the next slide. That wasn't so much the case. The thing here is often we think, okay, let's wait 14 days afterwards from major events, hoping that that would be it. And we waited 14 days from this investigation, and then about a little over a month later, at the end of January of 2019, we got the same kind of information coming into the same local health department that there were GI illness complaints after eating at this establishment. And yes, it was our place from outbreak number 1. Now, one thing I would like to also mention was that earlier on, I mentioned about the inquiries from the media, and then also the announcement that there was that there was positive for Noro there. And the establishment was well known locally, a favorite to many people. And what happened was that because the restaurant had taken such a hit, there was some pressure from some local government, not at the local health department, but internally amongst the town, to encourage town workers to visit the establishment because of everything they went through and how they had complied and done everything to fix it. So after that had happened, we started to get reports again that there was something going on GI related with this establishment. And some of those were actually employees at the local level of this town that the health department served. And that led us to outbreak number 2. Next slide. So the case definition for this one was very similar, just different period, but vomiting or diarrhea in a person. Our EPIs contacted and interviewed and requested stool samples from patrons, and we were able to get 5 of them. And then of the 10 patrons that were interviewed, 8 of them met the case definition. 2 workers reported illness and were instructed to submit a stool sample, and no common food items were identified here. This was a much smaller cluster than our first one. And you're seeing on the chart there, the size difference between the 2 there, but the commonality being us having somebody work, some food worker reporting symptoms and another one working while symptomatic. Next slide. 40 staff at the establishment were interviewed by the health department. And I mean, we talk about going in and interviewing staff after when it's new to them often, but in this case, they were being, many staff were being re-interviewed, similar questions as the first time. And 2 reported illness, 1 worked while symptomatic. Neither reported illnesses in the first outbreak. So that part's interesting, is that neither one of these reported an illness in that first outbreak that we had in December. And both ill food workers and 3 patrons submitted samples that were positive for Noro Genogroup 2 by our state lab. Next slide. The food establishment closed again, this time for more than 24 hours. It was from February 1st to the 3rd. And that was largely because they, at this point, were told they had to bring in a professional cleaning company who brought in a disinfectant effective against norovirus. The staff were retrained on the hand washing and minimizing bare hand contact and the new ill food worker policy. Supervision of the food handling by a food inspector for 4 weeks from that reopening. So the local health department actually sent out a food inspector right from the very beginning after all of this to make sure that not only did they do it, but that they were gonna follow the parameters that were established as part of their corrective action for the second outbreak. and reporting of food worker illness to the local health department for 6 months from that far out, a much longer term there. It's important to note in our code, it does reference that it is the responsibility of the food manager to report confirmed or suspected illness, which is tough in this industry, but they actually mandated this in a little harder with their reopening process. So they held their feet to the fire a little bit more with this after the second one. Next slide. 11 positive samples from the 2 outbreaks were sent to New York State, the Wadsworth Laboratory, for sequencing. Big shout out to New York on this one because, as you can see here, we actually had 6 total samples, 2 from the first one and 4 from the second one, that show within 0 alleles a link between the first outbreak and the second outbreak, and 1 worker in each of them, and it was not the same worker. And then 1 patron in the first outbreak and 3 in the second. So there was a link there. Next slide. So the final summary, a case control study implicated the salad as the likely vehicle for the infection during outbreak number 1. However, we didn't get such a link in the second one. We believe, due to inadequate control measures from the first outbreak, that it was possible for a food worker illness to contribute to the second. Whether it was through ineffective cleaning and disinfecting of the establishment, because we could not confirm that the product they used was effective against norovirus, or if they used bleach, if they made it to the proper concentrations to neutralize the norovirus. Despite recommendations from DPH and the local health department, staff were not retrained properly on hand washing or minimizing bare hand contact, as was saw when they were visited there, and then the ill food worker. So part of our interview at the in the beginning with them is we asked them questions about their the policies there and if they have them in writing, and also if they get paid sick time. And in Connecticut, employers with 50 or more employees are required to provide paid sick leave to service workers who meet a certain criteria. And it also requires that they have to be working at the establishment for quite a while before they can touch into that bank. They have to actually earn it, and then once they've earned it. So that could really impact the ability of the staff, whether they didn't know they had it or they didn't have enough to use it yet. And the norovirus may have persisted on the surfaces or been reintroduced by new workers, because it just kind of passing through people continuously until it resurfaced on the second one. Next slide. A big thank you again to the local health department involved in this. Our EPIs with the Epidemiological and Emerging Infectious Disease Program, our public health lab, and the food protection staff. And again, shout out to Wadsworth Lab in New York for helping us with the sequencing. That we could not have been able to prove that link between the two if it wasn't for them. Next slide. And that's my contact info, and good time for questions.
Great, thanks for that presentation, Matthew. All right, so if I can have Emma and Christopher also come back online, unmute your lines, or you can keep it muted until you're going to speak, but put your video back on. And we do have some questions from folks in the Zoom chat. So as you think of things, please continue to add those questions. And Tom, I'm going to hand it over to you to ask some of the questions.
Thanks, Valerie. The first question is for Christopher and Emma, but I think we can ask Matt to comment on this too. It's from Casey, and it is, did Restaurant A have any pushback during the outbreak investigation, including during the employee interviews and stool sampling?
So I guess I could speak from the environmental health portion, and maybe Emma can comment on her end, but we didn't really get much pushback from them on that. They were pretty cooperative the entire time, which was really awesome to work with them. So.
Thank you. And Matthew, anything to add? Oops, go ahead.
Sorry. Yes, I agree with Chris, and I think we always try to approach, our work with restaurants really collaboratively as we can. So.
And Matthew, in your outbreak?
They were very cooperative during the first one because it was new to them. Many of them were being educated on it. And then when it happened again, there was definitely a little bit of now that they were a little more informed on it, there was concern about, did I cause it, especially after everything that happened with the first one. But for the most part, the establishment was working on it. It was difficult for our local health department because of the pressure of the media, and also a little bit of that political pressure that local health departments may deal with. So there was a little bit of navigating that, but for the most part, they were cooperative and trying to do what was needed to remain open or get open as quickly as possible. So.
Thank you very much. Here's an interesting one. Let me see. This is for Christopher and Emma. Under what authority were you able to exclude food handlers for 2 incubation periods if they did not provide stool samples? And that was from Lisa.
Yeah, so I'm not gonna, I don't know if I remember exact regulations, but I believe we just general food safety laws, or not food safety, but general health department laws here in Rhode Island are kind of given the authority to rectify outbreaks how we best see fit for the most part. And that's, prevention and control, how we think we need to and how we need to progress. So there's that. I believe just the food code regulations themselves have something in there about in outbreak scenarios, it's kind of left up to the regulatory authority and maybe the state epidemiologist. And so our state epidemiologist was the one actually making all these decisions as well. So.
Great, thank you. Here's one for Matthew. During the 4-week observation period, what was some of the practices that were repeat violations, and how did the inspector handle it or re-educate the operators?
Well, that's a good question. I wasn't with the agency at that point in time, so I can't get into the exacts on that. But I do know that the main focus with us dealing with norovirus was the bare hand contact, the hand washing, and also the glove use. So that was the majority, like that was a large part of it, and making sure that during that 4 weeks that they were also checking in to make sure, hey, did anybody contact out? And while they were there, checking to see if anybody reported any symptoms while they were there. So that was about where they were going with that. I know that from reviewing this stuff, but I can't speak any further beyond that.
Thank you, Matthew. Here's one from Casey to Christopher and Emma. Was there any media or press release information where you divulged the restaurant a name? And if not, why did your DOH choose not to name the restaurant?
Chris, you want to go for it? I can.
Yeah, I mean, sure. So, I mean, I think in general, we just try not to just divulge the names of restaurants when they have outbreaks and everything like that during presentations. I think it's just our general practice. We didn't do any press on them at all, but we do try to keep their privacy.
Anything to add on that, Emma?
No, I think Chris covered it. Thanks.
And Matthew, if you didn't address it in your presentation, did you disclose the name of your restaurant?
So the name got out there probably through one of the many people who were ill, reaching out to local news or the reporter finding out that way. So it became apparent in the investigation where it was at the time, but it's up to either the local director of health in Connecticut to disclose that information, or with the guidance from DPH. So if they had product out there that was still contaminated or believed to be contaminated, the name would have been released if it wasn't already, if it was worried about the product still being an imminent public health hazard. But for the most part, that's not the case. But in this case, it got out there and it was decided on to release it that way. I believe that was done at the local level, and I don't believe it may not have been a Department of Public, a local health department decision. That might have been another decision. I can't recall the answer to that. So,
thank you. Yeah, those are always tough calls to make. Here's one from Timothy, again for Christopher and Emma. Any environmental swabbing of Maine lobster roll assembly area? It would seem with pre-cooked ingredients and staff wearing gloves that only direct glove to food contact would be when assembling final products for service.
Yeah, so I think that is correct. Like the direct glove contact to food contact when assembling was basically the only time they were touching it, right? But Currently, our lab doesn't have the capability to test for norovirus in environmental swabs and food. We really only have the ability through stool samples right now. So unfortunately, we weren't able to take any, I guess, food or environmental swabs.
Yeah, I kind of have a follow-up here from Shahira, which is a little bit related to that last question. The comment was, yes, any observation, I guess, of hand washing before they put the gloves on. So it sounded like you did an assessment of no bare hand contact. Was anything done to assess hand washing in that facility?
Yeah, that's my fault. I probably should have mentioned that. So we didn't see any issues at hand washing at the establishment while we were there. I do think generally restaurants are on their best behavior when health inspectors are in the room, though. So we didn't see any issues. I don't know if that means there weren't any issues, but while we were there, we didn't see anything going on.
Thank you. Here's one for Matt. Was there any noted deficiencies in active managerial control during interviews that stood out?
So we're in a unique spot because we have not fully adopted FDA food code. We still have our Connecticut code, although we do, when we train the inspectors, work on getting corrective action, and we're moving towards that. But at the time, active managerial control, that's where it came into reporting the symptoms, trying to think of any other no deficiencies during the interviews that stood out. No, it was really just the fact that we had staff who were experiencing symptoms and still came into work, and then the other ones where they may not have had symptoms. That's what they tell us, but whether or not that's the case is the difficult part. In this case, because of we're dealing with the salads, with the ready-to-eat food with no kill step there, it really became the thought process at the time that it was contamination through either an ill worker or contaminated equipment. Could have been really the most probable for the first one. So.
Excellent, thank you. And I think this one is probably from the first presentation, because I think, Matt, you talked about lots of problems with hand sinks in your investigation. So Mindy was asking, did any previous routine inspections result in corrective action? Poor hand washing practices, hand sinks not working, lack of adequate sanitation, etc., based on prior history. I think you did talk about an outbreak that occurred previously.
Yeah, and honestly, I'm not exactly 100% on their previous inspections. All the inspections are available online, at least routine inspections, so we could definitely check, but it doesn't sound like this was their first issue, and they've had 2 outbreaks, so I imagine there probably are some violations in there related to hand hygiene, but I don't know any off the top of my head.
Thank you. And let me see, this sounds like it's probably for everybody, so while we've got you up here, Christopher, do you know if there's a maximum repeat violations for any establishment?
I don't know the exact answer. I would say technically probably no. I mean, they could, I guess, get everything wrong, and that would maybe be the maximum, but I don't know if there's like an actual maximum for it. I mean, at some point we just ask them to voluntarily close, right? And you could consider that the maximum, right? I guess exactly when that happens is usually left up to inspectors and not to me. So I don't know exactly when they would do that, but yeah, maybe that would be the maximum.
And I can see Matthew nodding his head back there. I don't know if you have anything you'd like to add, Matthew.
Yeah, I mean, part of the difficulty for us is the fact that our inspection form does not note a repeat item on it. So it's really on the local health workforce, our inspectors, when they are out there and they see that, and they maybe do a review of the file and look back on the previous inspections to look to see, is this a practice that's been going, an issue that's been prolonging over a period of time? And then at that point, it becomes dependent on the nature of what the violation is, that the professional opinion of the director of health and or their staff to determine what that max would be before they would actually issue maybe an order to get them to do that. We all try to work with our partners at the food establishments to get corrective action, but also working on what's allowing it to happen. Why is this continually happening, and what can be done to stop it? So no formal maximum on that.
Thank you for that, Matthew. And I've got another one for you from David here. Does the Connecticut State Lab not have the ability to genotype, and does this hinder foodborne illness investigations within the state?
I may have misspoke. So they were able to get the Geno group through their testing, but we had to send it to Wadsworth for whole genome sequencing. So I may have misspoke on that.
And here's a question for everybody. Are your inspection reports readily available to residents, and do you give grades or scores?
I can go first. So depending on where you are in Connecticut, the inspection reports may be available. We are very much like a local authority on that one. So it really depends on what the local health department has available. We do have a score, and the way it's determined is based on the risk factor violations are kind of weighted higher than the non-risk factor violations. So in Connecticut, if they get a 4-point violation, which would be your CDC risk factor violations, holding, cooking, the standard, then that triggers it when an inspector needs to go back, and they are obligated to go back if they either get a score below an 80 and or have a 4-point violation. So that kind of determines how it's done here. At the time of this outbreak, we are moving forward with the FDA food code, which will severely change the landscape for us because of the fact that our new inspection form won't have a score. So it will be an interesting shift in how people look at the inspections, because right now, I can speak from personal experience, the first thing most owners or managers want to know is what their score was. Did they get an A? And we don't have a state letter grading system. We just have that 80 or 80 or above. But it doesn't equate to an A, B, or C, because you could particularly get a 96 and still have to have a re-inspection because of that 4-point violation.
Thank you. Emma or Christopher, anything to add from your state?
Yeah, so all of our inspections are readily available on our website. You can find them in I believe it's under the food inspection area. But then they do have scores. The scoring system isn't as straightforward as I'd like it to be. I mean, I think it ranges, from 100 to, and it can go negative potentially if they keep getting a lot of things wrong, which it doesn't make the most sense to me, but it's how it's set up before I was here. And so those scores and inspections are available online, and yeah.
Thank you. Here's another one for Christopher and Emma. How are the restaurants able to share a walk-in cooler? If you are aware, were there or are there any SOPs for the shared use and reporting illnesses between restaurants because of this? Isn't that a big food defense / protection concern? One sick worker at another establishment could affect another restaurant's food making. Traceback / investigations are harder. Want to comment on that?
Yeah, of course. So I said that more to kind of illustrate how close these restaurants were together. The cooler they share was really a backup cooler, so I don't think there's a lot of food that's normally stored in there to begin with. I was kind of just trying to get the picture out there that these restaurants are like right next to each other and they kind of share that area. But we did have several employees who worked at multiple establishments, and we excluded them as well. So we're looking at that to hope that we weren't having other people become ill as well at other establishments. So I think the same thing would have applied at the sister restaurant. And kind of like I mentioned before, they don't really share that many employees. I believe there's only 1 or 2. So as far as crossover goes, there wasn't a lot of issues, but I see where the concern might be about, a potentially employee contaminating one cooler and then another employee from a different restaurant coming in and picking that up. But yeah, so I guess I could see a little bit of concern there, but it doesn't seem to have been an issue thus far. And we don't have any SOPs for that at all for them for that restaurant. They meet our food code, and I think that's fine. Yeah, and I think there's a few questions in there. I think I addressed them. Yeah, so I mean, and that's
okay. Here,
yeah.
I think you addressed them too. Here's another one for all presenters. Were raw salad items discarded in case they were handled by ill workers or contaminated equipment after the first outbreak and/or the second one? So I guess that was mostly for Matthew, but you both were dealing with a with raw or salads that were not going to be subsequently cooked. So I think you can both answer that.
Yeah, so definitely food items prepared by ill food workers if they were available. That became part of the problem here. So we were when looking at the period and then the symptom and when it was reported to us, identifying those food items, but if they could certainly, the local health department was able to identify food items that were prepared by those, the discarding of that would have happened. So typically that, part of that investigation is, okay, this person, these people identified being sick before or after. Do we have any food items left from that? Being around this time of year, being Christmas, between Christmas and New Year's, the challenge there is a lot of people are dining out at this point in the time. So high turnover on products. So that became hard. So could it have been possible that some product may still have been out there? Very unlikely just because of the high turnover on food items. But it possibly could have happened, but that was definitely a challenge for the local inspectors to identify if there were any food items at that point in time left over from those people.
Thanks, Matthew. And while we've got you up here, I have a question from my longtime friend, Shirley. And she's got a question about what happened between the first and second outbreak. She asked, on the second outbreak, did those people who did work with symptoms, did they get trained in the first outbreak or were they new hires?
I don't know
I guess
the
she's
answer.
asking about maybe a failure between the two there.
Right. So it presumably majority of them would have been at least there, but there could have been staff that weren't present because this could have been before, we get a lot of, I would say, college age workers where they come in around the holidays when school's out. So it's possible that maybe we didn't get some people. So there is a chance that training could have been an issue where one or two people didn't get it. But from my understanding, the majority of the people that were supposed to get that training after the first one would have been there during the second. But there could have been one or two who may not have gotten it because they may have been a new hire. Although, the code does require that staff are trained on food safety items, including illness, when to report it. We also have posters that we give out to the establishments about reporting, not working when sick, reporting it to your manager. So the stuff should have been there for them to see it, but there could have been a breakdown. Absolutely.
Thank you very much. And Valerie, that's all I've got. I don't know if I missed any questions in chat, but feel free to jump in if you've got anything else.
No, I don't see anything, but I do see a lot of kudos for our speakers, Matthew, Emma, and Christopher. Everyone loves your presentation, and I want to echo that. Thank you all for sharing your important work on this. Norovirus is something that is pesky, it makes people sick, and it's highly transmissible. So it's really important that we really try to think about what are some things that we can do long-term as an intervention strategy to maybe mitigate or prevent norovirus infections in the future. And it sounds like your departments have done a lot of work related to that and a lot of education and provided some guidance materials. So thank you so much for sharing all that your departments have done. Any additional questions? I'll give you about 10 seconds more. I'll give you the Zoom pause for that. And I just see a lot of other comments just saying great job with the presentation. So again, Matthew, Emma, and Christopher, thank you so much. Tom, thank you for bringing up the questions. Everyone, we're going to give you a break until 2:30 p.m. Eastern. So please come back at 2:30 p.m. Eastern, and we'll have a presentation from Thomas Colaro from the USDA FSIS. And then just keep in mind, we're going to go into the rest of our program directly after Tom Colaro's presentation. So this is your last break of the day. So if you need to get up and stretch, please do so. And we'll see you back at 2:30 p.m. Eastern. Thank you again so much.
Hey, I'm not sure if you guys know, but somebody is sharing their screen. Chelsea, is
looks
that
like-
you?
It looks like it's Rochelle Evans' screen. So Rochelle, I don't know if you meant to,
Okay.
but you are sharing your screen nationwide. Hi, Tom. Do you want to do a quick audio check just to make sure you're all right?
Check, 1, 2, 1, 2, check.
Perfect. And then do you want me to bring up your slides or do you want to share your screen?
Please, if you could.
You've got it. Thanks so much. We'll get started in 8 minutes.
Sure.
It's 2:28 Eastern, so if you are near your computer and you hear me, come back and settle down. Or if you're multitasking, get ready. We're going to get started in about 1 minute. Welcome back, everyone. It's 2:30 p.m. Eastern, so we're going to get started with our next presentation. Our next session is a USDA and FSIS update. Our speaker is Thomas Collaro. Thomas is the Deputy Regional Director at the United States Department of Agriculture, Food Safety and Inspection Service, the USDA FSIS. He's worked for the USDA FSIS for 25 years in various capacities. He has lived and worked in New England for the last 15 years and has been in his current position as the Deputy Regional Director for the Northeast region within the FSIS's Office of Investigation, Enforcement, and Audit for the last 2 years. Welcome, Tom, and please unmute yourself and get started when you're ready.
Hey, thank you, everyone. Good afternoon. So just a quick word. My allergies are acting up. Ragweed is doing its best to kill me. So if you hear me start to sneeze and itchy eyes and runny nose, I'll survive. It is just allergies. So next slide, please. So just a quick background, and I kind of structure this, give you a little quick background on FSIS, our division, my division. We'll talk a little bit about grinding records, our grinding log rule, and we'll talk a little bit about the illegally imported meat and poultry products from China. In order to get there, I'm going to have to talk about import products, on how we inspect import products, and you'll catch on pretty quick how we differ from FDA. And I won't go too much into the FDA part of it, but I will give you a background on how we inspect imported products. So a little background on the Food Safety Inspection Service. We are the public health agency within the USDA, and we're responsible for ensuring the nation's commercial supply of meat, poultry, and egg products. Again, both domestic and imported. And the mission is pretty simple. Any meat, poultry, or egg products, we want to make sure they're safe, wholesome, correctly labeled and packaged. And we get our authorities through essentially 4 acts: the Federal Meat Inspection Act, the Poultry Product Inspection Act, the Egg Product Inspection Act, and then for humane handling, we get that through the Humane Methods of Slaughter Act. And if anyone's read The Jungle by Upton Sinclair, that came out in the early 1900s. The Meat Inspection Act came law in 1906, so it's been around a good while. And then obviously the Poultry Inspection Act came probably 50s, and then the egg and humane handling sometime in the 70s. Just give you a quick timeline. Next slide, please. So our division, the Compliance and Investigation Division, we investigate violations of food safety, food defense, and other consumer protection statutory requirements. We control unsafe or volatile products through detentions, civil seizures, and voluntary recalls. We develop our cases through surveillance and investigation activities to ensure that appropriate criminal, administrative, and civil sanctions are carried out according to agency laws and our regulations. Next slide, please. So our role specific as far as food safety, we investigate foodborne outbreaks. Obviously just anything involving meat or poultry or egg products. If it's lettuce or tomatoes, obviously that's FDA, and we partner with CDC, states, locals, the FDA, you name it. We also have our Homeland Security mission area, which is including preparation, detection, prevention, protection, and response to biosecurity threats within the United States. And we have regulatory oversight over the transportation, storage, and distribution of meat, poultry, and egg products in commerce. So we're split up within FSIS into the inspection staff, which is the in-plant personnel. And then my division, once the products leave the inspected facilities, we take over as far as jurisdiction. So you'll see us at distribution centers like Cisco, you'll see us in restaurants, you'll see us in retail markets. We're out there. It's only about 150 of us. So you may not see us every day, but we are out there. Next slide, please. And we achieve the agency mission through surveillance activities, and that's just what we term inspection activities. We conduct investigations, liaison activities, product control actions, and food defense activities. Our food defense, everywhere we go, we ask essentially a set of questions as far as food defense, try and assess each firm's process on how they conduct food defense, whether it's cameras, what controls they have in place as far as employee movements, things like that. Next slide, please. All right, so we'll talk a little bit about retail record keeping for establishments and retail stores that grind raw beef products. Next slide, please. So this is our standard slide, and you all may have seen this before, but CDC estimates that each year, roughly 1 in 6 Americans contract a foodborne illness, approximately 128,000 hospitalizations, and right around 3,000 deaths annually. Contaminated meat and poultry products are responsible for about 22% of these illnesses and 29% of the deaths. Between 2007 and 2013, we investigated 130 outbreaks. Of those, 24% were linked to beef ground at retail. And we'll get into a little bit here. Next slide, please. And this just talks about how we came to publish the final rule for retail grinding. So ground beef can be produced from materials from multiple suppliers and multiple production lots. The meat industry is exceedingly complex. Any pound of ground beef you may purchase at any store in America, that can have anyway, one animal or hundreds of animals. The grinding process can spread pathogens throughout each lot of ground beef, and additionally between lots if grinding equipment and/or food contact surfaces aren't properly cleaned. And that can be throughout the day or even days. And I'm sure some of you have seen some of these retail markets where they're not doing a real good job of keeping the grinding equipment clean. And that's what we mean. If you have a contaminated piece of beef that you put through the grinder and you're not cleaning that properly, you can have days worth of production out there with pathogens. And as I'm sure you're all aware of, the consumer doesn't always cook ground beef fully to destroy pathogens. And we struggle with that every year. Our Office of Public Affairs is constantly putting out information to remind consumers to cook their ground beef properly and handle it properly. Next slide, please. So in 2015, we published the final rule called the records to be kept by official establishments and retail stores that grind raw beef products. And our rationale was that it will improve our ability to accurately trace the source of foodborne illness investigations involving ground beef and to identify the source materials that need to be recalled. It really does no good if we're just at one retail store and we're asking the retail store to recall product if the processor is the one who contaminated the products and obviously has additional stores that they're selling to. We'd rather get it all the way to the processor if possible. And we also stated in our final rule that it will provide FSIS with proper documentation and efforts to trace ground beef products back to its suppliers. The next slide, please. And here's the 5 parts of the retail grinding record keeping. And I have the next slide over shows you kind of an example of a grinding log so you guys can see it. But I'll just read the slide, and I hate reading slides, but I'll read this to you because this is our rule. The establishment numbers of the establishments supplying the source materials used to prepare each lot of raw ground beef products. All supplier lot numbers and production dates, the names of the supplied materials, including beef components and any materials carried over from one production lot to the next, the date and time each lot of ground beef product is produced, and finally, the date and time when grinding equipment and other related food contact surfaces are clean and sanitized. And when we do get out to retail and start verifying these, that often is the one that most stores leave out, is the when they clean and sanitize their food contact surfaces. The next slide, please. And here's just a quick, this again is in our final rule, and you'll see this out and about if you're at retail stores. This is our kind of our template grinding log. We don't mandate people keep it just like this, as long as they're keeping the 5 parts of the rule. However they want to do it, we're okay with it, as long as they are maintaining these as logs. You'll see some stores do electronic grinding logs. They'll scan them in. They have computer systems. Some stores do it like this, where they're just notating it down, handwriting. And I'll give you kind of where we are as far as compliance rate. So far this year, we've conducted just over 1,500 grinding record verifications. Of them, just over 57% were compliant. So we do have a long way to go before we get full compliance with our grinding record rule. Next slide, please. All right. So we'll talk a little bit about imported products, and then we'll get into the China thing, which should be pretty interesting. Next slide, please. All right, so our country imports a substantial amount of meat and poultry products. We regulate meat and Siliformes, which is essentially catfish, poultry and egg products. All remaining foods are regulated by the FDA, and we do have an equivalency process. So what that means is we deal directly with individual companies and coordinates with the government of the country before accepting any meat, poultry, or egg products for sale into the US. We work collaboratively with the importing establishment's government, and we use a 3-part process to verify the equivalence of other countries' regulatory system for meat, poultry, and egg products. It is exceedingly robust. Next slide. And this gives you kind of the life cycle of how we do that. You'll see document analysis. We do on-site audits, and we try to get out there. I think it's every 3 to 5 years, we actually do an on-site audit. And we do 100% port of entry reinspection of any imported meat, poultry, or egg products. Next slide, please. And this just goes into how we start the process if a country wants to export meat to the US. So they first have to complete an eligibility application package. Once we receive the complete application, we conduct an initial document analysis to evaluate their laws, regulations, and other written information. And we say it has to be equal to our system. And we do have a pretty robust inspection system. We have an on-site team that review process occurs when a technical team visits the country to verify that information. And our component consists of government oversight, statutory authority and food safety regulations, sanitation, HACCP, which is hazard analysis and critical control point systems, chemical residues. They have to be able to test and identify chemical residues, and microbiological testing programs. They have to test for pathogens. We also look at the laboratories. We look at their training programs. We look at their in-plant inspection operations, just like we would if it was a domestic company. Next slide, please. So if that on-site audit has been successful, we publish a proposed regulation to add the country to our list of eligible exporters. We just announced Lithuania to export egg products to our country. So if you have a subscription to the Federal Register, you would have seen that come out maybe last week or two. So there's a time period where the agency, FSAS, must collect public comments to this proposed regulation, and that helps us make a final decision on whether the country can be eligible to export meat, poultry, egg products. The only one that I remember that really had a lot of public comments when we decided to let China export products to our country, export poultry products. That generated a ton of public comments. Next slide, please. So we do not actually conduct the food inspections in the foreign country, nor do we certify the individual foreign establishments to export to the US. After we determine that a country has an equivalent food regulatory system, we rely on that system to carry out the daily inspection. We conduct re-inspection, and again, that's 100% of imported products upon the product's arrival to a US import facility. And our import facilities are privately owned. We have inspection staff within those facilities throughout the country. Next slide, please. Again, any foreign establishment that desires to export to the US must apply to its own government. So the government has to apply to us, and then any establishment within that country applies to their own government. That country's competent authority must certify to the FSIS a list of all establishments in that country that meet FSIS's import requirements. And our eligible foreign countries and certified establishments can be found at this website. And they are also listed in the Code of Federal Regulations. For meat products, it's in 9 CFR 327.2. For poultry, it's 9 CFR 381.196. And for egg products, it's 590.910. And the 9 CFRs, it's 301 to 590-ish is where you find anything, any federal regulation to FSIS. And this changes pretty often. Our list of export establishments that can export here. We're constantly updating that list, adding, delisting, what have you. Next slide, please. So after an incoming shipment has met US Customs and Border Protection and USDA APHIS requirements, and if you know anything about USDA, I think there's about 27, 28 different agencies. APHIS is a big one with us, and that's the Animal Plant Health Inspection Service. They, to simplify it, they deal with all the live animals and all the live animal health restrictions. Once the animal is slaughtered and processed, that's where food safety inspection comes into play. So once it meets their requirements, the shipment must be re-inspected at an FSIS-approved import inspection facility. I'll give you a couple APHIS requirements. So there's some countries that have hoof and mouth disease, whether avian influenza, African swine fever. There's a whole list of countries and areas within certain countries that they're ineligible to export to the US based on their live animal health restrictions. So we have what we call a public health information system, PHIS, and that retrieves the US Customs data from their automated commercial environment, and that's called ACE. PHIS is a centralized computer database that generates the type of inspections that are performed on each lot of each shipment and stores those inspection results. Next slide, please. Again, we re-inspect 100% of all imported meat, poultry and egg shipments. So we look at proper certification documents. Do they have the right paperwork? We look at transportation damage. We look at general labeling, general condition, and box counts. And to give you some examples of our physical examinations. So we'll look at if it comes up in PHS, most of the time it's simply just a paperwork check, or we open the trailer just to make sure everything's kind of okay. If PHA spits out, all right, we're going to do a physical examination. It may be a net weight check, maybe a condition of container. If it's a canned product, it may call for an incubation. If it's a cooked beef product, we'll do what we call a pink juice exam, which is literally exactly what it says. We'll take that cooked beef and squeeze it. And if it comes out pink, a little bit old school, but if it comes out pink, we take that to mean that product was not fully cooked. We do a lot of lab analysis on imported product for E. coli 015787, the other non-0157 S-Tex, Listeria monocytogenes in ready-to-eat products, and then salmonella in ready-to-eat products. We do residue tests for veterinary drugs, pesticides. We do food chemistry, species identification, and finally pathology. Next slide, please. So if you're in a store and you see some imported product, product of Australia, product of New Zealand, what have you, you should see a little legend like you see on the bottom right, where it says I-38. 38 is not a real number, that's just our example number. But you'll see any inspected imported product, you'll see the I, and then followed by the actual establishment number. With the exception of Canadian product, only Canadian product, we don't stamp it based on a relationship with Canada, how much product moves across the border each way. We just essentially stamp the paperwork. So it's a little more difficult to, if you're just out in a retail store and a distributor, to verify that product did actually come across the border legally. Next slide, please. All right, so we'll talk about the ineligible meat and poultry products from the People's Republic of China. Next slide, please. And I can't talk too much about it because it is very much an open investigation, but I do want to touch at least a little bit on it. So I gave you kind of a quick background on how we inspect meat and poultry products from all over the world, right? So again, just to recap, they must be produced in certified establishments in eligible countries. The products must be presented to FSAS for import inspection prior to entering US commerce. And that's raw soliforms fish, processed chicken, duck products. We've seen all these things from various establishments in China. They are ineligible to export those products to the US. Some products, depending on where the actual raw materials originated, can be imported to the US. Like I said, when China became equivalent, it generated a lot of public comment on our rule. Meat products are a no-no. They cannot be imported to our country. Next slide, please. All right, so I'll give you a quick how we even got into this mess. So during a routine inspection, CBP observed irregularities with entry documents, and they moved that shipment for further examination. So the entry documents said it was this, whatever that commodity was, and CBP expected that commodity to weigh X. In reality, the shipment weighed Y. So they said, yeah, something's not right here. We need to move this over and get a better look at it. So the examination showed undeclared mismanifested meat and poultry products from China. They controlled the shipment and referred the issue to APHIS. Now, CBP has a memorandum of understanding with APHIS, so they work very, very closely with each other on the border. So we just happen to be conducting on-site liaison activities. They brought it to our attention and we initiated an investigation. Next slide, please. So as the result of the investigation, we announced a public health alert for 43 separate products. That public health alert has now grown to over 689 various meat and poultry products from China. And why we didn't request a recall, that product was all mismanifested. We have not been able to identify actual importers. This was a smuggling operation, so they took great pains to ensure that individuals weren't identified that, like, hey, Tom imported this product, go find them. It wasn't like that. So we were unable to find any sort of actual importers. What we did do was translate the PHA into Chinese, both simplified and traditional. Next slide, please. So if you're out and about, if you see packages and it's all in Chinese, that's usually a pretty good indicator something's not right. In this case, that's exactly what we're seeing. They do not identify an eligible establishment number on the packaging. These products were not presented to us for import inspection. They are ineligible to import to the US, and they are unfit for human consumption. We are working diligently with both CBP and APHIS on this investigation, and it's going on 10 months, give or take, at this point. And I have some photos in the next few slides, so you can at least see kind of, next slide, please. So you can see kind of what we see. So this is a retail store. I want to say it's in Brooklyn, but I'm not 100% positive. And you see on the bottom middle, and I'll get a closer view here in a minute, that's duck blood from China. And you'll see in the next slide or two, these packages, what they actually look like. Next slide, please. And here's a closer view of this product. In English, it says duck blood, and then in Chinese, it says duck blood. Gives you a price, and you see the actual package. So we're seeing this everywhere. This is by far the most popular product. It is an automatic violation for us. You know, it is an automatic destruction for us. There's no other option for the retailer. So we're seeing this in all kinds of ethnic markets that cater to the Chinese population. And we're also seeing it in these hot pot restaurants, and they're all over the place. So yeah, so I'll answer the questions obviously after, but one just popped up. What is duck blood used for? You'll see it a lot in the hot pot shops. They use it just to coagulate whatever hot pot they're using. And they just, I mean, it's in a lot of different meals and dishes that the Chinese eat. Next slide, please. And here's what the actual packaging looks like if you're looking at the actual face of the package. This one is in English, which is a little bit of a rarity. This is a very, very, very popular brand. We see this everywhere. Next slide, please. Now, this is probably the second most popular product we've seen, and this is a pork sausage. I think I have a closer up view. Yeah, next slide, please. And this package, you see the labelings all in Chinese. There's no English. This for us. This is again an automatic issue. For this product, we actually have to call in APHIS. This has to be incinerated based on the animal health disease restrictions. We can't actually open this in the retail environment to destroy it ourselves. It has to go to incineration. And this is a pork sausage. Next slide, please. And this is the box it comes in. If you happen to be in a distributor and you see the box, the vignette is very identifiable. This little lion guy. A lot of the packages we'll see here in the next couple slides. Next slide, please. You'll see this advertisement for these products. Next slide, please. This isn't a great picture. Next slide, please. And here's just a variety of different products. And this is very much what the packages look like. I know it's not great on this slide, but they are all in Chinese. Some of the, what to look for, what we look for, they'll have these little cartoon characters. It may be of a pig if it's pork. It may be of a duck if it's a duck feet or a duck tongue, something like that. But it's usually a little cartoony animal of whatever is in that product. Which makes it pretty convenient for us when we're out and about. Next slide, please. And this is, again, another very, very popular product. And this is kind of a pork bun from China. And you see this is a nice little picture vignette of the product. And you can see the pork depicted is pretty nice. Next slide, please. And these are a little closer up package of a few slides ago. Still not a great picture, but you can see the little duck guy on the bottom there. They are very, I mean, they have great packages. They're very colorful. You know, they have this little duck eye on them. I think this is a duck feet. So I'm trying to get close on the slide here. That is a duck feet product. And for the Chinese, this is a snack. Like, you know, in America, we may have a beef jerky or pork rind or something like that. This for them is the equivalent. It's just a quick snack. Next slide, please. And this is the same product, essentially, just a different brand, different packaging. This might actually be a different part of the duck. I'm not 100% what that is based on the picture. And that should do it. Next slide. I think that's the end of the presentation. I saw a bunch of questions come into the chat.
Yeah, thanks for that, Tom. We're actually going to have Tom Nerney go through some of the questions with us now. So go ahead and leave your video on and your audio on. And Tom, take it away when you're ready. Tom, if you are speaking, you're on mute. Tom Nerney.
Thanks. Sorry about that. The old double mute. Thanks for that great presentation, Tom. We do have a bunch of questions in chat and more are flooding in now. Mary asked, can the local health specialist request to see grinding logs? And I know Jennifer had commented that, you know, she always does ask to see them. But is that something, you know, you would hope local and state inspectors would look for when they're in a retail establishment that grinds meat?
Yeah, and that's I don't want to say it's a loaded question. You know, we have this conversation with a lot of local and state regulators. You know, depending on where you're at, sometimes, you know, there's no training for you, right? And that's part of the issue. What am I looking at? How do I evaluate compliance? Things like that. And if you're doing, say, an illness outbreak investigation, you may be requesting those grinding records as part of that outbreak anyway. And I would say, yeah, you absolutely can see it. If you have any questions, my contact information should be on the thing here. Just reach out if you have any questions on what you're seeing. Is it in compliance? What information you can derive from it? What does it mean? You know, we'll do our best to answer all those questions. But yeah, you absolutely can request, in my opinion, right, to request grinding records.
Thanks for that answer, Tom. And thanks for always being a help to all of us here in the Northeast U.S. Most people probably don't know, but if I'm asked the USDA FSIS question from our states and locals, it usually makes its way to you and your team. And you and Susan Iceberg and all the rest are so fantastic to work with. Edward asked, are on-site inspections unannounced when you do that?
Yes. So the foreign, yeah, it gets a little iffy for foreign. So domestically, our inspectors are in these plants every day. For slaughter plants, we're in there the entire time they're slaughtered. So there's really no surprise, right? I mean, you're there from open to shut. And if you're just making, say, ground beef or boning out chicken, something like that, you know the inspector is going to come today. You just don't know when in the day the inspector is going to come. So yeah, it's unannounced. As far as doing foreign visits, it's a little tougher to do it unannounced for obvious reasons. You know, we're having to liaison with the foreign government, our liaison, and you know, oftentimes they're a little more formal, those visits. But for domestic, yeah, they're unannounced. And for us, they're always unannounced. If we go to a distributor or retail market, we're just showing up.
Excellent. And I have another question here. How do you evaluate the quality of the products, the handling procedures at the source from the country of origin? I know that's probably a pretty complex answer, but if you could provide maybe a little more detail on that.
So let me try and find that question so I have it. So I mean, for as far as quality, you know, it's not our business quality, right? It's just if it's safe, wholesome, unadulterated, properly marked and labeled. And for that's a pretty easy standard for us, right? Either it meets the labeling or it doesn't. And we have labeling regulations and they're federal regulations, right? So they're very specified. As far as adulteration or unwholesome, it's a sniff test. You're looking at it, you're evaluating it, you're doing the old sniff test. If it's something for lab analysis, the lab is going to tell you whether it has a pathogen or not. But yeah, for us, we're pretty old school, and we've been like that since 1906. Did that answer? I'm sorry.
All right. I think that helps. And
Okay.
Marguerite asked where she could find a list of the authorized foreign establishments for export to the U.S. I think you included one on one of your PowerPoint slides. Is that correct?
Yeah, so John Zeberon, he works with us. He's an investigator in North Carolina. He posted in the chat our library of eligible foreign establishments. So if you're in the chat, you can click on that. It brings you right to our website, and it'll show you each establishment, each country, and even within that country, which products, beef, pork, chicken, cooked, raw, what have you.
I've got a couple of questions here on lab-grown meat. Irene asked, is lab-grown meat regulated by FSIS or by FDA, since it's not real meat? And another question that asked if lab-grown meat is sold here in the USA. Maybe you could talk about that a little bit. I think it is coming pretty soon at some point in time.
Yeah, so we are in talks with FDA, right, on who's going to regulate it. I think we actually have a signed MOU. So and this isn't my area of expertise, but I could probably send something out to point you to the actual what we signed with the FDA and how we plan to regulate it. Essentially, the FDA is going to, and talk in general, right? The FDA is going to regulate the cells. We're going to regulate the product derived from those cells. It's not really here yet. We're hearing, I think it's expensive right now. But we are hearing, companies are gearing up for this. So in 5 years, 10 years, it might be a very different conversation we're having here on this seminar.
All right, let's see. A number of folks asked if there's a special number or website to report if they come across those foreign products you were talking about a little while ago.
Yeah, and I can drop that into the chat as well once we're done here. If you have a USDA contact, reach out. And my information is there. Just reach out. If you see it, just let me know where you saw it, take some photographs, what have you, just point us in the right direction. We have a number of other venues that you report, either telephone, 1-800 numbers, and I will put that stuff in the chat. Consumer complaints, and we'll put that stuff in the chat for you guys. But yeah, there's nothing wrong with just reaching out to one of us and saying, hey, this is what I saw, this is where I saw it.
I had a couple of questions that deal with the destruction of those products that cannot be opened within a retail establishment. And I think you mentioned that they would need to go to incineration. I have a question here that says, can you explain why meat products have to go to incineration? How come they can't be opened?
It's the animal
What's the
health
concern, I guess?
So the risk, APHIS, they update the animal health restrictions for each country on a regular basis, right? So for right now, products from China, we don't know where that product's derived from. So we consider that it's poison, right? I don't have a better word, but it's napalm. We don't want to open it. We don't want to release any potential foreign matter into the United States that may be not good for agriculture and may not be good for our economy. We're seeing that now with like the spotted lanternfly and some of these invasive species. That's really what we worry about. Something that's going to be opened into the United States that we really can't handle.
Yeah, those are really becoming a problem. I've seen them around. We've got them in Rhode Island, all the way up in Rhode Island now. Definitely in Pennsylvania. Here's a question. Do you allow local regulatory authority to remove products from shelves to hold for you?
Yeah, so the only thing we would ask, obviously, right, you guys do your thing. If you're embargoing it, I would say before you ask the people to destroy it or what have you, just let us know so we have a chance to follow up and deal with it as well. And especially with some of the product that has to be incinerated, let us take that product. APHIS, we work with APHIS. They actually will take it. They'll take it to an approved incinerator. They'll really get the destruction properly. But yeah, if you guys want to throw a tag on it, tell the store to hold it in the back, give us a call. We're happy to follow up.
And Tom, were those pictures taken here in the United States? We had a couple of folks asking if they make it onto the shelves in the U.S. and they could be making their way into restaurant, as in recipes, unbeknownst to the consumer.
Absolutely, yeah, that's where we're seeing it. Yeah, we've controlled, I would say, over 1 million pounds in commerce at this point of the investigation. And that's in distributorships, retail markets, restaurants, you name it.
I think, Valerie, I think we've addressed most of, here's one more. Did you say that initial foreign meat suppliers / processors are inspected by USDA when they submit application from the country of origin government to the US government?
Yeah, so
I guess the question is, will you inspect them if the country of origin has an MOU with the US, or do you rely on the foreign entity to do the primary on-site inspection?
We rely on the foreign country to do the actual day-to-day inspection. When we do the on-site, that may be a plant we visit, right? It's just, hey, we're going to pick a plant at random. We're going to go to this establishment within that foreign country and just make sure what they say they're doing, they're actually doing, and really put our eyes on the process, talk to the people there, and really get a good feel for, are they doing what they say they're doing? But yeah, the day-to-day, we rely on the foreign country to do those inspections. And the same thing applies for us when we export product. The foreign country is relying on FSIS to do those inspections.
All right, great. Let me see. I thought we were all caught up here. It looks like a couple more popped in. For meat that is processed and sold within the U.S., what label information or stamp needs to be provided on these packages? Are there indicators we should be looking for to make sure they are approved as well?
So yeah, that gets a little tricky. At retail, particularly, it gets a little tricky, right? So you should see, if everyone knows what the U.S. market inspection looks like, you should see on a retail package, one, it should be in English, right? And the label should be pretty appropriate to what you would see domestically. And it's a real label, not just something like, hey, it looks like some Yahoo just slapped this label on a product. It should be in English. It should have, the features you would expect on any label. It should have a foreign establishment number, and you can actually check that on our website that John provided the link to. Check to make sure that establishment number you're seeing is still relevant on our website.
Thanks for that, Tom. And it looks like we have one last question. Someone stated they noticed that a lot of, sometimes they're in a grocery store and they will find that there are no grinding logs. Should they just contact you folks if they see that?
Yes, please. Yeah.
All right. You got a
we're not,
there.
We're not going to go down like stormtroopers. It's going to be more of a education type activity for us. We're not interested in just, throwing people in jail for not keeping grinding records. We really do want to make sure they're educated, relay how important it is. Not that it's just simply required, but there's a real public health benefit to them keeping grinding records, and try to relay that information and make it as easy as possible to the retailer to comply. That's our main goal.
And it can limit the scope of a recall as well.
Yes.
For them. So it's really to their own benefit, right?
Yeah, and we really do try and stress that. If you're a small mom and pop and you have an outbreak, you're going to go out of business. If you can't point the finger at a processor, good luck to you. And we try and stress that point. You don't want to be the one holding the candle as it burns down. You want to make sure someone who actually is responsible for counting that meat is the one we're visiting.
All right, thank you so much. I'm going to, I think that's all I've got, Valerie, unless you noticed something I missed. Hopefully we've got everyone's questions answered. I will turn it back over to you.
Thanks, Tom.
You're welcome.
Tom Calero, it's the tale of two Toms right now, but Tom Calero, I just saw one other question pop up in the chat. Are foreign countries required to have English somewhere on the label for meat products?
Yeah, and that's going to be your first hint that product's not legit if you're not seeing English. And the same applies for the FDA products, right? If you have a package of breadcrumbs, you should see English translation somewhere on that package. It's the same for us. That product can't come here legally unless it has English on the label.
Very good. Thanks so much, Tom Calero. Thank you so much for joining us today and providing the update for USDA FSIS. It's always a pleasure to see you, and we hope to see you in person soon as well.
Yes, thank you all.
And you're getting a lot of kudos in the chat, so make sure you take a moment to take a look at that. All right, so remember I said we're not going to have a break, so we're going to go right into the remaining portion of our session. And I see also, Tom Calero, that everyone's telling you to feel better as well. So we hope you're able to get your allergies under control and feel a little bit better.
Thank you.
We are going to go right into our recognition portion, where the retail food specialists are going to recognize all of you and your program standards accomplishments. So if Tom Nerney, Steve Natras, Mary Leong, and Christine Applewhite can go ahead and turn your videos on, and you can unmute your lines when you're ready to speak, I will start sharing our presentation. So can I have someone just confirm that they're able to see the presentation?
See it.
Perfect, thank you. Appreciate it. Like, I hate to get started and then start talking and then no one sees it. So I appreciate it. Thank you. All right, so we're going to be going over the 2022 Voluntary National Retail Food Regulatory Program Standards accomplishments. We have included accomplishments from all of our 7 New England states, as well as accomplishments from Pennsylvania and New Jersey, who were formerly part of the Central region. And the reason we've done this is because Tom Nerney and I are specialists that work with Pennsylvania and New Jersey. So we wanted to make sure that we shared the love and we included their accomplishments as well. The first slide shows the Northeast Retail Program Standards accomplishments for 2022. And this is a high-level overview. If you look at this pie chart, there were 13 new enrollments in the program standards within the past year. There were 8 jurisdictions that conducted a full self-assessment of all 9 standards. And then there were 6 jurisdictions that worked on Standard 7. And when I say worked on Standard 7, what we're really looking at is whether or not an SA was conducted or a VA was conducted, or both of them were conducted. So if there was any work done on Standard 7, that's represented here by 6 jurisdictions. For Standard 3, there was 1 jurisdiction, and there was 1 jurisdiction also that worked on Standard 2 over the past year. And for Standard 1, there were 8 jurisdictions that had worked on this particular standard. And we're really happy to see that because, again, that regulatory foundation is really what is an important foundation for your regulatory food programs and for food protection. So we're happy to see that, and thanks for all of your work on that. This shows you as related to the Retail Flexible Funding Model, or the RFFM awards for the past year. And Liz O'Malley is going to talk a little bit later in her presentation about the RFFM and the current opportunities that are open. But we wanted to give you an idea of how much money went to jurisdictions in each of the 9 states that are covered by the retail food specialists for this geographic area. So you can see the range is pretty high, but there's a lot of money that has gone to all of these different states. And these are state, local, territorial, and tribal jurisdictions that receive this funding through the RFFM. So if you are on the fence about applying for RFFM funding, please reach out to us as your retail food specialist, and we'll help you work on some projects. There's still time to apply for next year's funding cycle. So please reach out to us. We want to help you find something that will work for you based on your current workload, and really help you invest in your program. That is the whole point of the Retail Flexible Funding Model. We want you to work on the retail program standards that then results in an improvement in your program. So again, we're going to dedicate some time today to have each specialist recognize their jurisdictions for their accomplishments since last year's seminar. We want to thank you in advance and for your continued commitment to your retail food safety regulatory programs and your continued work on the program standards. And without further ado, I'm going to pass it over to Steve.
Hey, good afternoon, folks. So yeah, some great things happening in Connecticut. We've got some jurisdictions that are just getting their feet wet in the program standards, some that are progressing nicely. I want to give a big shout out to Chatham Health District, who got a very large chunk of that $500,000 you saw in that pie chart. So kudos to them. And just a little quick story about Chatham Health District is they began as a mentee in the Nature Mentorship Program. And that mentorship program pairs folks that are more experienced with less experienced folks in the program standards. And they work together to try to progress in the standards. Chatham started as a mentee in that program, and now they are mentor. And they are currently mentoring 4 different health departments, 3 of which actually are in Massachusetts. So what's cool is you can interact with folks across the border with this mentorship program. And please note that that is an optional add-on on the flexible funding model. So if you have any questions on that, reach out to me if you're in Connecticut or Massachusetts, and stay tuned for further information from Liz on that. So let's advance the slide, Valerie. And you can see some of our partners here that are progressing in the standards in various steps. Advance, please. And as I mentioned, West Hartford Bloomfield Health District, they are one of the they are one of the loan mentors in Connecticut, mentees rather, that are being mentored by Chatham Health District. And I will turn it now over to Tom.
Hey, thank you, Steve. There are a lot of great things happening in Pennsylvania. The Pennsylvania Department of Agriculture received, actually, yeah, thanks. Actually, there were 3 jurisdictions that received funding in Pennsylvania in 2022. And I'll talk about a little bit about each of them individually. If you could advance the slide, please. The Pennsylvania Department of Agriculture received $95,904 in 2022. This included $10,000 to work on individual standards, and I know they're making a lot of progress with standards 2 and 9, among others. They also received $14,000 to take advantage of that mentorship program that Steve was just talking about, and they are a mentee who are currently working with South Carolina Department of Health. They got an additional $7,355 in training funds, and pretty much, I think all of my jurisdictions that got funding got training funds money. But their largest award came in the form of a capacity building grant. They received $63,550 to assist local health departments from throughout Pennsylvania with the retail program standards. And I was fortunate enough to be able to attend their first local health department training session. It was under a month ago in Harrisburg, and there were a number of local jurisdictions there, and I know a few expressed interest in enrolling in the standard. So if you're interested at all, please contact me. It's an easy process. There's a 1-page form that needs to be filled out, and we can get you rolling. And I really want to thank Heather Sanders and Ben Werrick for the work they did on that. Perhaps the greatest thing about that award is that it's actually a 3-year award, so they'll receive another $47,000 for each of the next 2 years to continue that work. Pennsylvania Ag managed to conduct a self-assessment of all 9 standards in 2022, and they received verification audits for standards 1, 3, and 7. So I want to congratulate Sherry Morris and Stephanie Smith on their grant award and their exceptional leadership. And I know they'll continue to significantly advance their program and assist others in 2023. The city of Harrisburg received $78,500, $71,000 for maintenance and advancement of their standards. And that too is a 3-year grant. They'll receive that funding each year for the next 2 years. And they were also awarded $7,500 in training funds. So congratulations to Nelva Wright. I know she continues to push forward with the program standards despite some recent staffing challenges. And I was really pleased to enroll the Erie County Health Department in the standards in 2021. They received almost $5,000 to conduct their first self-assessment, plus another $7,500 in training funds. So congratulations to Brianna Adams and her team for securing this funding. And I also want to thank her personally for assisting Pennsylvania Department of Ag with their Standard 3 verification audit. Next slide, please. I'm really excited with the direction in which the Maine Department of Health is moving. After being significantly short-staffed for years, the state provided them with resources to hire 6 additional inspectors. And despite the growing pains involved with hiring, onboarding, and training 16 team members, the Maine Department of Health was able to secure $5,000 to conduct a full self-assessment in 2022. And after a bit of a long hiatus, it's great to see them refocused on the retail program standards. So congratulations to Lisa Silva and Becky Walsh on the grant award. And also congrats to Lori Davis and Scott Davis, our 2 standardized food safety inspection officers in Maine, on their recent promotions to supervisory inspectors. I know that was a long time coming, and it's well deserved. With that, I think I'll turn it back over to Steve. Yes.
Thank you, Tom. So the Commonwealth of Massachusetts, wow. Where do I even start? Well, what I'm going to say is that we have a whole slew of jurisdictions participating actively in the program standards in Massachusetts, including 10 that just enrolled this past fiscal year. And I'm going to have, you can note that there's 20 jurisdictions receiving a retail flexible funding model of funding for 2022. There's just so much going on in Massachusetts. And Valerie, I'm going to have you slowly advance the slides, because there's not 1, not 2, not 3, but 4 slides of agencies working on the standards very actively. So it's a very busy state. And just some late breaking news. We have Southwick Board of Health that just enrolled. The city of Springfield, Massachusetts just enrolled. And I want to note that Burlington just met Standard 3 and had that verified. So there's a lot of great work going on in the Commonwealth. I just want to mention too that Chatham has 3 mentees in Massachusetts, Burlington Board of Health, Methuen, and Webster. I also want to briefly mention that in Massachusetts, given that they're a home rule state, some of these folks are working just as 1 or 2 people health departments. Many of them are working collaboratively in program standards networks, helping audit each other and doing great work. Just a couple that come to mind, and this is not all inclusive certainly, but the Berkshire Regional Planning Commission is doing great work by bringing many towns together and progressing their retail food protection programs. The Tri-Town Health Department working with 3 different towns, and they are also advancing and progressing in the standards. So a whole lot of exciting work going on in Massachusetts. I will pass it over to Valerie. Great job, folks.
Thanks, Steve. All right, I'm going to be going over some of the accomplishments for New Hampshire. So in 2022, we had 1 jurisdiction that newly enrolled in the retail program standards, 1 jurisdiction that conducted their full self-assessment of all 9 standards, and 1 jurisdiction that received RFFM funding for 2022. So to show you some names, the City of Nashua Environmental Health Department, shout out to Heidi and Ren. And Heidi was one of our panelists earlier today. I'm really pleased to welcome you to the program standards. They enrolled over the summer. So I'm really excited to start working with you and really see what your program does with the retail program standards. So welcome, and we're glad that you're with us. The Concord, New Hampshire Health Department, shout out to Gwen Williams. Gwen received funding for 2022 to conduct a full self-assessment of all 9 standards that I know she has been diligently working on. And so I'm excited to see what's next for Concord, as well as Exeter. James Murray, Exeter provided their 3958, stating that they conducted their full self-assessment of all 9 standards in 2022 because it was due in 2022. So I'm really happy that James is relatively new, but I'm so happy that he is here and that he's starting to get a little bit more involved in the program standards. I would also like to point out there are a lot of other folks that are enrolled in New Hampshire, and I look forward to working with all of you. I was just at a self-inspecting city and towns meeting last week, and I was really excited to talk to everybody about where they are with the standards and what their plans are for the current funding cycle and the future. So I look forward to working with all of you. For New Jersey, the Township of West Caldwell Health Department enrolled in the retail program standards and received RFF funding for 2022. So shout out to Nagyan and Bill. Nagyan is currently working on the full self-assessment of all 9 standards. And Nagyan is brand new to this retail program standards as well. So it's been wonderful to work with her, and I look forward to continuing that relationship and seeing what her program does with the program standards. And with that, I'm going to pass it on to Mary.
All right, thanks, Val. So for New York, we have 3 jurisdictions that receive RFFM funding for 2022. Next slide. So we have Genesee County Health Department and Orleans County Health Department. They both are working to complete their next self-assessment of all 9 standards by the end of this calendar year. We also have Suffolk County Department of Health Services that have completed their 3rd self-assessment of all 9 standards and reported meeting standard 3. So I want to congratulate them and recognize their progress in the program standards. So great work. Thank you. Back to you, Tom.
Thank you so much, Mary. Next slide, here we go. The Rhode Island Department of Health has been making steady progress on the standards for quite some time. They currently meet standards 1, 4, 5, 6, 7, and 9 through verification audit, and I know they are dangerously close to meeting all 9 standards. This year, they received grants totaling $158,946, which included $40,000 for maintenance and advancements of the standards. And again, that was a 3-year grant, so they'll receive that level of funding over the next 2 years. They also received $100,000 for capacity building, and this too is a 3-year grant. It will help Rhode Island pay for a retail standards coordinator, support a communications position, and help pay for various IT resources, including computer inspection software upgrades. And Rhode Island is sharing their wealth of experience with other jurisdictions. It's currently participating in that mentorship program, for which they received $12,000 to mentor the state of Montana. And of course, they took advantage of the training funds in the amount of $7,500. So congratulations to Kathy Feeney and her entire team. I know Lydia Brown and Katie Sylvia also worked very hard on the standards. And I want to especially thank Kathy for her assistance in providing PA a verification order for standard 1. Next slide. Vermont. Last but not least, the Vermont Department of Health received the most funding of all my jurisdictions. It totaled $161,620 in 2022. It included $55,000 for maintenance and advancement, and this was a 3-year grant. $100,000 for capacity building, and that money will help fund a program standards coordinator, not just this year, but over the next 2 years as well. So that position will be funded through 2024, and an additional $6,620 in training. So congratulations to Liz Wursing and Andy Shepard-Phils for their leadership in obtaining these funds to advance conformance with the standards in Vermont. And before I turn this over to Christine, I wanted to take just a minute to thank everyone throughout the Northeast who assisted me and my colleagues with conducting our risk factor data collections over the past couple of years. Your help with those assignments is crucial for the success of that project. And I really appreciate the help and truly enjoyed working with each of you in the field on that project. And I look forward to working with all of you in the future. Back to you, Valerie, I think.
I'm actually going to pass it to Christine. Christine, if you are speaking, you are muted.
Sorry about that, I was. You guys are doing some great work out there with the program standards. So for those of you who are not currently enrolled in the standards, or if you are enrolled but haven't been doing
much with them. We've all been very busy lately, and you're looking to get back into them, please contact your retail food specialist. Here's the email addresses for everybody. You'll notice I'm not on there yet, getting there, but please contact your specialist, and they can definitely provide you with support and resources to be able to get you going. We like to see more people enrolling for next year too. Next screen, Valerie. Okay, so for those, some of you may know about our Northern Branch 1 program standards support calls. These are for those of you who are enrolled in the program standards. So the purpose of this verification audit cooperative work group is to help the regulatory jurisdictions working with retail food specialists from the Northern Branch 1 states, which is all of you, to assist each other in completing timely verification audits for the retail program standards. All regulatory jurisdictions that are currently enrolled in the standards are welcome to participate in this voluntary program. The only request is for jurisdictions to attempt to conduct at least as many verification audits as they have other jurisdictions complete for them. So our next call for this work group is going to be on Tuesday, October 4th from 10 to 11 a.m. And this particular call is going to feature a presentation by Marlene Johnson from the Burlington Board of Health in Massachusetts. And Marlene is going to be discussing their jurisdiction's work with Standard 3. This is a great opportunity for those of you enrolled to be able to listen to the work that your neighboring jurisdictions are doing in regards to the program standards and see how you can glean from them. Next slide, Valerie. So just want to reiterate what all the other specialists have said, and congratulations on all of your retail program standards accomplishments for the last year. Can't wait to hear about your accomplishments face-to-face next year at our meeting in 2023. So I am going to now turn it over to Elizabeth O'Malley, who is the Branch 1 Director for FDA's Office of State Cooperative Programs Division of Retail Food Protection. And she is going to be providing our closing remarks for the session today. Liz, whenever you're ready, go ahead and unmute and turn your camera on. Thanks.
Thanks, Christine. Can you hear me and see me?
We can.
Great, terrific. And Valerie, you'll be moving the slides, we'll be pulling them up.
Yes, pulling up now.
So hi, everyone. As Valerie pulls this up, I'm just so happy to be here with you guys again. I realized when everyone was talking before that there's so many new names and I don't know so many of you. And when I was writing my presentation, I said, oh, I probably know everyone, and I guess I don't. So I just wanted to briefly say that I've been in the cooperative programs here in retail for 20 years and worked with so many wonderful people, and I really can't wait to meet all of you next year. So Val, you can move the screen forward, like. So I hope that everyone's enjoying the seminar so far, and thank you to the presenters today who did a fantastic job, as well as the specialists running the show in front of the camera as well as behind the scenes. But those of you who have been to the seminar before, you know I always like to highlight some of the exciting changes that have happened since our last seminar. And first, I'd like to extend a warm welcome to our colleagues in New Jersey and Pennsylvania who have joined us today, including all of the state, regional, county, and local regulatory agencies. As mentioned, Valerie and Tom have been working with these states, and we look forward to including them in our Northeast calls and working with them more closely going forward. I'd also like to extend a welcome to both Andre Pierce and Christine Applewhite to our staff in OSCP, or the Office of State Cooperative Programs. As you may have heard, Andre comes to the FDA as the Retail Division Director after more than 30 years of working as a with the locals, coming to us from Wake County, North Carolina. So he brings a real breath of fresh air and a real boots on the ground perspective, which is really nice. And I guess most of you on the call probably know Christine Applewhite, formerly of Connecticut DPH, who joined FDA in January. He definitely hired two of the best people out there, and I would like you to help me welcome them to their new positions. I'd also like to welcome Ben Metcalf to the seminar. Ben is now the Inspection Program Manager with the Maine Department of Agriculture, Conservation, and Forestry. We've also lost some people to retirement since we last met. Tracy Weeks, the coordinator of Connecticut DPH's food protection program since 1998, retired at the end of June. Luckily, I hear that Tracy is working part-time for Connecticut, doing some various projects, so I'm excited to continue to work with her. Jessica Fletcher, who worked with both tribal and local health departments in Connecticut, retired in July. I don't know if many of you know Jessica, but she was a long-term local rep from the Northeast to the Conference for Food Protection, and she did a bang-up job representing all the locals at the conference. John Seifert, a longtime seminar supporter and attendee from New Hampshire DHHS, also retired, I think it was in March of 2022. And Bill Manley retired on August 31st, 2022 from New Jersey Department of Health after a long career in public health and food safety. And as I was typing those up this morning, I was thinking, God, I'm so close to retirement. I can almost taste it, but not quite. But I'd also like to congratulate Darby Greco, who has recently been promoted to Deputy Director of the Division of Environmental Health Protection for New York State DOH. So congratulations, Darby. We can move forward. Val. Thank you. I would also like to recognize and congratulate the newest FSIOs, Food Safety Inspection Officers. These individuals who are successfully standardized in the interpretation and application of the food code since the last seminar. As Andre said yesterday, your role in the National Food Safety Program is critically important because you're the key players in multiplying out the knowledge and experience you have gained to others with whom you work. So I'd like to extend congratulations to Rob Eiler, Gina Scammon, Robert Bruce, Heather Sanders, and Deb Schober. Congratulations to all of you. I also want to mention some updates to the program standards since we last met. In August, FDA released the 2022 version of the standards based on the recommendations from the last Conference for Food Protection. I think you'll be really interested in some of the changes made to standards 2, 6, and 8. FDA also developed an easy-to-use summary of changes document, and all of this was put up recently on our updated website. We can put the links in the chat for you. If someone would just drop those in, that would be really helpful. Next. 2022. Oh, you can move it forward, Val. 2022 also ushered in year 2 of the Retail Food Flexible Funding Model. Earlier, you heard the specialist mention many of the jurisdictions that took advantage of the funding opportunity in order to build their programs and improve their capacity and infrastructure. I know the Northeast was really kind of slow to warm up to the standards. I've been around long enough to have heard that over the years. But hearing about the awards you've all received and the progress you made as a result of the funding is just really amazing. And to hear how you're all working together, mentoring, forming networks, being mentees to those that have real experience in this, it's just really, it's great. So please continue to do that. The portal for year 2 is open until October 12th, so please take advantage of the funding opportunity. There's about $6 million available going into year 2. To be eligible for the funds, you must be enrolled in the standards. Otherwise, the rules are pretty familiar to year 1, and the same portal is being used. If you have any questions, please reach out to either NEHA or your retail food specialist. And I put the NEHA information up there if anybody needs it. As part of the Retail Food Flexible Funding Model, NEHA is also conducting a retail food safety regulatory needs assessment to gauge the training needs for the regulatory retail food safety community. The purpose of this needs assessment survey is to identify retail food safety regulatory training and resource needs across the country. The survey will try to determine strengths of the retail food safety community and assess the gaps in education and training needs. The results will be shared with FDA, who will try to bolster educational resources, reduce knowledge gaps in training materials, and improve workforce capabilities. NEHA is being really ambitious, and they would like to have 10,000 survey respondents. I truly do hope you will participate in the survey. It should take about 10 minutes. I took it the day it opened, and it took no more than that. And all responses are anonymous. The survey can be found on the seminar's homepage, NEHA's website, or the Association Collaborative's website. The needs assessment is only for retail regulatory professionals. Professionals working in industry or academia will be redirected to exit the site. Thank you. So besides funding, a critically important thing that the retail food specialists do to help our partners with the retail food program standards is put on self-assessment verification audit workshops that they have developed and delivered. In 2022, we offered 3 face-to-face and 2 virtual courses nationally. I'm excited to announce we've already planned 4 for FY23, 2 instructor-led virtual workshops, 1 in January and 1 in March. And we will also hold 2 in-person workshops, 1 in association with AFTO's annual education conference and 1 in conjunction with NEHA's AEC. Working with NEHA, the FDA is also finalizing a set of online self-directed modules of the SAVA workshop. This self-assessment verification audit series consists of 10 self-guided courses, which provide relevant information and instruction for retail program enrollment or advancement in conformance with the standards. All the courses are independent and self-guided. However, the completion of the first module is mandatory. It's an administrative and introductory module. And once you take that one, you can access all the other 9. Participants can repeatedly access any or all of the 9 retail standard courses on demand or take them as refresher training. I encourage you to take a look. And again, we can put the information in the chat. So what else does 2023 hold? CFP will be held in Houston in April, and our retail food seminars will be available. Let me just say something about CFP, and our specialists will be able to coordinate calls to help explain the submission process or answer any questions you might have. I'm also really excited that we're planning face-to-face seminars next year. I feel like I've been in my house for 3 years, and it's really time to get out of here and go and see everybody face-to-face. Again, as I heard the names popping up before and being mentioned, I realized how many people I don't know. And really, it's unacceptable. We need to get out there. I need to get to meet all of you and talk to you and learn what you're doing firsthand. Locations across the country are still being finalized, but we look forward to sharing the information about that really soon. Thank you. I know this year you've all heard a lot about the new era of smarter food safety, which is FDA's blueprint for the future. I just want to talk for a few minutes about some items that may be of interest to you and you may hear about at your state and local levels. I thought you might be interested in hearing what we're doing to ensure the safety of food produced or delivered via new business models and how we acknowledge the need to modernize our current food safety approaches. FDA is looking to address the protection of food from contamination as new business models continually pop up and change to meet the needs of the modern consumer. The evolution of how food gets from farms to our tables every day continues with the emergence of e-commerce and the new meal delivery models, and is forcing us to reevaluate and change the way we do business. We need to modernize some of our traditional retail food safety approaches and be open to innovation, change, and applying strategies that we haven't yet thought of or used. Move forward. Thank you. As stated, the evolution of how food gets from farm to table to our kitchen tables has completely changed with the emergence of e-commerce and new delivery models. These new models include online shopping for meals and groceries, a practice that surged during the COVID-19 pandemic. But even before the pandemic, we saw online grocery shopping growing, but the pandemic sped this up at a precipitous rate. Research indicates that online grocery shopping is expected to grow to as much as 20% of the market share of food and beverage sales in the next few years, with an estimated 80% of Americans engaging in online grocery shopping by 2024. It's estimated that online shopping will be a $100 billion annual spend by 2023. With that in mind, we at FDA are trying to change our food safety paradigm a bit and determine whether or how our existing regulations even apply to specific e-commerce activities. We're looking to address who owns that last mile or how we can best protect the food coming into your kitchens. As you might have heard, we held a new business model e-commerce summit in October of 2021. 2,800 individuals attended with 44 countries represented. Some of these countries are way ahead of us in the online arena. Common themes emerged and are being addressed. We learned that we must continue to work with key stakeholders to make sure that the growing business model ensures the safety of food. We will continue to partner with CFP, the Conference for Food Protection, and USDA to promote the CFP direct-to-commerce and third-party delivery guidance. We also need to build new relationships and partnerships with food delivery companies to provide education on the importance of proper food handling, including outreach to delivery services that we've not worked with before, such as the Postal Service, UPS, FedEx, Uber, Lyft, DoorDash, and the multitude of others that are just popping up every single day. And we need to acknowledge that we need to learn more about labeling in the online grocery experience. Next, please, Val. As part of New Era, there's also going to be an independent review conducted of the entire retail food safety system, not just of the federal government, to evaluate its effectiveness towards meeting our public health goals. And we will be asked to answer such questions as, what are the current strategies being used to reduce and prevent foodborne illness? Are they working? How is everyone working together towards that end? What are we doing really well, and what can we do better? The thinking here is that modernization is going to have to address a few key issues. We need to improve our focus on using risk-based methodologies and root cause analysis in our inspections and our investigations. We need to consider how we can advance inspections from activities that just look at food code or health code violations to activities that incorporate education and coaching. And since the results of the FDA risk factor study tell us that facilities that have a well-developed food safety management system have fewer occurrences of foodborne illness, we also need to assist with the implementation of these well-developed food safety management systems throughout the retail food industry. And lastly, we need to share and implement interventions that positively impact food safety behaviors and practices. Next, please. Thank you. So for the road ahead, we want to continue to capitalize on the successes we've had in the last year working with our stakeholders. You heard yesterday about the many projects that the Retail Food Association Collaborative has completed or is currently working on. These projects can be viewed on the collaborative website. I highly encourage you to take a look at it and maybe use some of the materials. We will continue to work with our partners to increase uniform adoption of the FDA food code by our state, local, territorial, and tribal retail food protection programs. I think Steve Mandanak mentioned yesterday something about the Association Collaborative and their development of a toolkit to help everyone navigate the adoption process. And you also heard that the CDC is assessing state-level adoption of specific food code provisions on how they relate to norovirus prevention, or the relationship between provision adoption and norovirus outbreak rates. We want to work with each and every one of you to ensure everyone is focusing on risk-based inspection methods. We want to help address barriers to conducting risk-based inspections that you face in the field. And we have heard from our stakeholders that there is a need to improve outbreak investigations, so that to that end, we will continue to work with our collaborative partners to provide you all with training such as root cause analysis and CDC's foodborne outbreak environmental antecedent training. Recently, the collaborative announced a new library that provides retail food regulatory professionals with a collection of vetted resources, such as trainings and guidance documents that support effective foodborne illness outbreak investigations. Many of you may have received that email and have direct access to it, but you can go to the Association Collaborative website and find those. And lastly, working with CFP and others, FDA will continue to promote food safety cultures and food safety management systems within the retail and food service establishment. We also want to share and increase the use of novel intervention strategies that positively impact food safety behaviors and practices. To bring it all home, food safety can't be done alone at any level. We need to work together, and seminars like this are critically important to learn from each other, share what we are doing, and highlight our successes and novel ideas so we can make real progress in the fight against foodborne illness. Next, please. And so, as I said, thank you to all the presenters, the attendees, and everyone who helped put this seminar together. I really want to give NACCHO a shout out. They were wonderful to work with and supplied us the platform this year. And I really look forward to physically seeing everyone next year, because talking to this computer is really awkward. And I really do miss seeing everyone. So I'll turn it back to Valerie, I guess. Thank you, everyone.
Great. Thanks so much, Liz. And yes, I'd like to see everyone, but I still want to implement business comfort where I can wear a jacket and my pajama pants. Can we work that out?
Yeah, I'm okay
said
wearing
no.
pajamas.
Wear your
next year.
suit.
No. We can. I don't care. We can wear pajamas next year. It could be a sleepover. I really don't care.
Excellent. Thank you so much, Liz. With that, I'll just bring this session to a close. I want to thank all of you as attendees for providing all of your really thoughtful questions for our speakers. I want to thank all of our speakers. Thank you for the time that you put into your presentations, as well as taking the time today to answer questions as they came up too. Again, just to reiterate, thank you to Conference Direct and NACCHO for the support to make sure that we were able to get through this session without too many hiccups today. It was fantastic, so I do appreciate it so much. And last but not least, thank you to my colleagues, the retail food specialists, Christine, Mary, Tom, and Steve. Thank you all so much for helping to find speakers and to help make sure that everything went smoothly in the background. We want to make sure you know that this is not the end of the seminar. There is still day 3 on Wednesday, tomorrow, and there will be general session. So there will be topics of national importance that are coming up. And then don't forget, we're still not done after tomorrow. We also have on Thursday, the workshop for the risk factor studies. So if you have been looking at Standard 9 and you're kind of like, ooh, I don't even know what to do with this. I don't know what a risk factor study is. I don't know how to touch this. I don't know how to start this. Please join us for the workshop on Thursday. We have specialists that are going to be going through everything from A to Z related to risk factor studies. And we want to make sure that you know how to do it and that you have some tools and you find out about some tools that we have available for you to use. With that, do any of the specialists or Liz have any other remarks?
No, I just wanted to remind everyone, I mean, I know we've had a long day here, but both the Southwest and the Pacific sessions are still going on with some really great speakers and presentations. So feel free to jump over there. You know, they're not just open to the folks that live in those areas.
Great, and that's a great point. All right, with that, we will let you all go. Thanks again to everyone, speakers, presenters alike. We hope to see you next year in person. Thanks so much. Take care.